Sir, you're charged with especially aggravated kidnapping. You're also charged with aggravated assault, and you're charged with theft of a firearm worth less than $2,500.
You're talking about stuff that is not relevant.
Hello and welcome to the Court of Public Opinion. I am the Recovery Addict, and boy do I have a case for you today.
Why is the dog chewing on this guy?
I think they have got the wrong guy there.
Got the wrong guy, and the dog was biting him.
He roughing him up quite a bit. There's a lawsuit.
9 out of 10 judges prefer watching the Recovery Addict live stream in their courtroom.
The fireworks are not done.
Now we're getting commentary on the case.
Oh, for crumb's sake. I didn't ask you to interrupt me.
Is that correct?
Not him, he Anglican, or he's very much Latino.
Welcome back to the Court of Public Opinion. I am the Recovery Addict. Hope you're having a fabulous afternoon. Hope your lunch was good. I know it was short. Don't complain. We get what we get, and we don't throw a fit. That's how it works. All right. I'm not a kid. All caught up. Wonder how many more days still to watch. I think we're looking at about, it's like 1 to 2 weeks, right? That's around 2 weeks for this trial, I think. OKC is going nuts. Basketball team Thunder Parade is going on near me. Crazy. Congratulations to OKC. Winning the NBA Finals. Didn't watch it. As a matter of fact, I didn't watch any of the games. Not just in the finals. I haven't watched a single game this season. I just haven't had time or desire. Or the ability. Let's add that. I don't even know if I have a single device that would be able to receive one of those games. But congratulations to the winners. The winners. I did hear that OKC won. All right. Chat switch on. There we go. Thank you very much, Josh. I don't know why that command doesn't work anymore. It used to work beautifully. I think I need to change the... Oh. I could fix this. Josh, I could fix this so you can control it. I just need to fix the IP address that's attached to the command. I can do this. The ability to do it does not mean that we'll get done. Let me make that first clear, first and foremost. But watched the final game last night. Only game I watched all season. Grandson's a big OKC fan. We live in Dallas-Fort Worth area. As your legal advisor, if someone says to you that you promised lunch, please respond, I don't recall. I don't recall. All right. Here we are back in the state of Connecticut, where truth, equity, and justice prevail over not recalling anything. This has been a sort of frustrating case. And maybe it's the age of the witnesses, and it's, a maturity thing. A lot of them like to think that they're quite mature now, but they still behave like they probably did when they were 17, 16. Need that for a soundbite. It's pretty much my slogan, Red Pen. That's the slogan for the channel. The ability to do it does not mean it will get done. Yeah, sorry about that. Lisa, you can't hear me. Try turning the volume up. Can everyone else hear me? Check 1, 2. Test 1, 2. Yep, it's working. The last witness was quite snippy or defensive or something with the defense attorney. Yeah, in a big way. We caught up now. Yes, we are. The catch-up is over. I think we're about to actually go back to court in just a moment. This court has been prompt. They've been on. Well, if they're late, we wouldn't know it because we've been speed trialing, so we've been just zipping through things. So this is 3 high schools and a bunch of young adults from one party with a fight and then another party with another fight. Yeah. Actually, accidentally said, I don't recall to my boss. And he was like, yeah. How was your lunch? Mine was great. I had McDonald's, which I have not had in, I don't know, it's probably been over a year since I've had McDonald's. And we went, because, for 2 reasons. We ordered food. We don't normally order food. First and foremost, unless we're like on the road somewhere, and then it's much more convenient to order food. And even then, a lot of times we'll bring our own, like make our own sandwiches, bring the jar of peanut butter and the bread. What trial was that from? I forget. Where you have spare sandwiches in the back. That's us, right? When we travel. But with our upstairs AC having not been functioning, it's It's at least blowing air now. It's now at 91 degrees upstairs, which I think is going the wrong direction, but it's a very hot outside. So it's, do I still have a loaf in the car? Then we might, Teresa, like half a loaf just in case. Check under the seats. Anyway, with it being so hot in here, we said we're not cooking. Like zero cooking shall happen. And that was Jen McCabe. How quickly he forgets. A long time ago that she was testifying. That was like over a month ago. Anyway, that'd been 2 months. Anyway, we got McDonald's, and I ordered their app, so now I have I don't know how to claim it. I should have Snapchat Plus for a month for free. I don't know what I'll do with it, but anyway, ordered a bunch of chicken nuggets, which the kids ate some of. Ordered a couple quarter-pounder cheeseburgers, which the family ate one of, and I had a Big Mac, which I ate one of as well. All right, we have a call here, and I don't have the plug. Hang on 1 second.
To accept, press 1. To send a voicemail, press 2.
Hello?
Hey. No, I just had to talk. You were just talking about going on vacation and having sandwiches and whatever. We used to do that all the time. We used to do that. We would rent a town car for 2 weeks, and we would just bring a cooler, and we would get like 5 slices. I would ask, can we have 5 slices of ham, and can we have 2 pieces of cheese?
5? 5 slices?
Well,
that could have been 5 sandwiches.
It was just for the day. It was just for us. And Paul, my wife, is in the back of the seat. She's making them sandwiches, and we're driving. We're going to California from Minnesota.
That's hilarious. Yeah, it's fun times. It's always good when it's like, hey, who's hungry? And we're like, yeah. And we're passing the restaurants and like, all right, reach back into the cooler and grab a sandwich. No crumbs in the car, please. So awesome.
So I just, I love your show. I'm really sorry that I have not donated yet.
Oh, don't be sorry. Don't be sorry.
No.
Just being here is great.
No, you know what? If I do, yours is going to be the one. You have the best show. It's amazing.
Well, thank you. Tell me your name. I missed it while I was trying to connect the phone. Who am I speaking with?
Art Grego. Well, I mean, that's my YouTube name.
Okay. Wonderful. Well,
but anyway, I love, like the lawyer, when I finally get over myself and I donate, it's going to be...
The Honorable Judge Murphy presiding.
Good afternoon. Good afternoon, everyone. Thank you. You may be seated.
So does he. He's amazing.
Okay, we're back in court. We're back in court.
The witness back in the witness stand.
Thank you so much. Appreciate the call. All right, bye. Wow, the court came back hot. Art, thanks for the call. Appreciate that. Sorry, my phone wasn't rigged up
And I just
properly.
want to remind you that you do remain under the obligations of the oath that you took when you first entered the witness box, okay? Thank you. And Attorney Smith, you're welcome to come up at any time.
Attorney Smith, who is defense attorney, come on up, front and center.
Huh? You did?
Well, now we've got a prank call.
Thank you. All right, welcome back, ladies and gentlemen of the jury.
Sorry.
It's all right. All right, counsel, at this time, I would like you to please stipulate to the presence of our jurors.
They will stipulate. Defense stipulates, Your Honor.
All right, thank you so much. Attorney Smith, you may proceed.
Continuing cross-examination.
Okay, Mr. Connery. If I can reorient myself to where we were. Okay. I think you had just told us that a Shelton High School kid threw a punch, but you can't recall who that person was, right?
Correct.
How far away were you from where the person threw the punch?
I was at the mulch pile, so 5 to 10 feet.
5 to 10 feet away.
Yeah, that's about that from the.
You couldn't tell who it was that threw the punch?
No.
But you could tell that it was a Shelton High kid?
Yes, it was from someone's back. Someone's, like, their backside was towards me.
And you said that when you ran over to where Ryan Hines and Raul Valle were fighting, that they were just tussling, right?
Yeah, they were fighting.
No full punches were going on.
I don't recall the specifics, but they were fighting.
And they were fighting on the ground, right?
I don't think so.
And you said at some point you took Mr. Hines's place after you pushed them apart, right?
Correct.
And that you made eye contact with Mr. Valle, right?
Correct.
And in fact, when you described that to Officer Bango on July 9th, you told him that he stared into your soul and made creepy, demonic eye contact with you, correct?
Yes.
Demonic eye contact?
It was eye contact of someone who knew what they were going to do. It looked very unpleasant and very scary.
He made that creepy demonic eye contact. You know the one. The stank guy.
And then you said at some point the fight just stopped, right?
Yeah.
Do we see the fight just stop on that video?
No, it keeps going.
Wendy.
So this end of the fight where it just stopped, that occurred sometime after the end of the video, right?
When I referred to the fight just stopped, that's referring to when me and Raul have separated.
Okay. So after you and Mr. Valle separated, the fight continued, right?
Yes.
And who did you see involved in the fight at that point?
I don't recall seeing what happened after that point.
Did you see Faison Teal?
No, I did not.
Did you see Matthew Lockovich?
No, I did not.
Did you see Alex Bernson?
No, I did not.
Did you see Tanner Chernowski?
No, I did not.
Did you hear Tanner Chernowski?
No, I did not.
I'm going to ask you to watch what is labeled as States Exhibit 60. And if we can see the 25% with the frame numbers on them, please.
Slow motion version. We're going up and over the jury.
Let me ask this to be paused at various points, okay?
Okay.
Pause right there, please. Do you see at frame 330 the person that you've described as Ryan Hines?
Yes.
And is he the person to the left of the screen wearing the green sweatshirt and the black shorts with the white trim?
Yes.
Can you play it again, please? Just from where we are. Did you see rain falling through the course of that video?
Yeah.
Do you recall it being misty and rainy that evening?
Yes, I do.
Do we have the ability to go to certain frame numbers on there? Yeah. Okay. Can you take us to frame, just start at the beginning at frame 0? Okay. This is the very beginning of this video, correct?
Correct.
And in this video, I'm going to point that on this screen.
Okay.
Your screen. Do you see the green sweatshirt, black shorts with white trim here to the right-hand side of the screen?
Yes.
Do you see beside that a pair of lighter color shorts with a dark shirt on top?
I'm sorry. I can't see what you're pointing.
I'm sorry, just to the right of the person you described as Ryan Hines.
Yes, I can see that.
You can see that on your screen as well?
Yes.
Is that you?
No.
You were wearing a dark top and light shorts that day?
Yes.
And who is that?
That's not me.
How do you know that's not you?
Looks like there's a logo on the back of the shirt.
Okay. Can we go to frame 10, please? And I'm going to point here on this screen again. Do you see the green top, black shorts with white trim that you've identified previously as being Mr. Hines?
Yes, I do.
And do you see beside him the dark top with graphic on the back and the white shorts?
Yes.
And do you see beside that another person apparently wearing light shorts and the dark top?
Yes.
Is that you?
Not that I recall, no.
You recall telling us that you were close to Mr. Hines, correct?
Yes, but before the video is when I had my interaction with him.
Before this video is when you had the interaction?
Yes.
And can we go to frame 14?
Apparently they don't have the frame-by-frame counter. 1, 17, 16, 15, 16, 19, 13.
I have a little trouble zooming, getting to that pinpoint. Okay, that's 16. Fine. Let's go with 16 there.
No, 14. Got it.
Okay. And do you see in frame 14, again, green top, black shorts with white trim over to the right-hand side of the frame?
I see that, yes.
And do you now see two people with lighter shorts and dark tops, one of which has a graphic on the back, one of which does not appear to have a graphic on the back?
I see they both have graphics on the back.
When you say they both have graphics on the back, the farthest one to the right, do you believe that's a graphic as opposed to that person's head?
Yes, it looks like a graphic to me.
What color shoes were you wearing that evening?
White.
Would you agree that these two people both appear to be wearing white shoes?
No.
No.
That looks like black.
I don't know who it was. Definitely wasn't me.
Can we play through to frame 29? Would you pay particular attention to frames 25 and 29? Can you see the counter on the bottom?
Yes, I can.
That was it. You missed it. You were watching the counter, weren't you?
Do you see from frame, here we are at 22, is there a way to make it progress
slower?
Frame by frame?
Oh.
Do you see now, okay, here we go.
Is he getting stabbed right there?
Let's stop there. Did you see those two people kicking their legs?
No.
No. Is there a way to, does that have a playback speed on it? You can slow it down. Really just want to focus in on 25 and 29.
I've got it, but... This is the bamboo walls you're looking at. It's actually cement, but... We're way past.
Can we go back then to frame 79?
77, 78, 81.
Thank you.
There we go.
That's fine. Yes, thank you. Perfect. Now, can you see this on your screen as well?
Oh, yes, I can.
And do you see sort of center left, again, Mr. Hines, green top, black shorts, and white trim?
Yes, I see that.
And do you see this person with dark pants, a white top, and some sort of multicolored graphic on the back?
I can't see what you're reporting, sir.
Right in the middle.
Mr. Hines, sir.
Oh, you're talking about looks like long black pants, like the closest person?
I think so, yes.
Can you point it again? Because I'm sorry, you're blocking my vision.
Do you have
No way for me to do so.
Do you have a pointer here?
Yeah.
Could you use that?
Last witness.
Thank you so much.
Do you see this person right
Yes.
here with the dark pants and the white top and the multicolored
guy right
graphic
above
on the
here.
back?
Yes, I do.
Do you know who that is?
I cannot tell, no.
It's as high as the mouse.
Where were you while this frame is being seen?
I believe I'm in the far back.
In the far back.
So-
When you say in the far back, behind this group of people?
Yes, behind that, yes.
And you see Mr. Hines here?
Correct.
And you believe at this point you'd already been stabbed?
Correct.
You believe Mr. Hines has already been stabbed?
Correct.
Can we play forward to 112?
I think he's right.
You see a person on the ground here, Mr. Connery?
Yes, I do see that.
Do you believe that to be Tyler DaSilva?
I can't tell in this, but
Well, you described him before as wearing a blue baseball-style jersey, correct?
yes.
And can we play it to 135? Here we are at frame 135. You see the gentleman with the white shirt, multicolored graphic on the back, and the dark pants to the right?
Yes.
You see beside him a person with a dark shirt, light shorts, and some light shoes.
Yes, I do.
You see beside him another person, dark shirt, light shorts, white shoes.
Yes.
Would you agree that this person that we've just described in the dark shirt, light shorts, and white shoes is going to the left of the screen towards this altercation happening to the left?
Yes, it looks like that.
Would you agree that these other folks we've described, these two on the right-hand side, they are participating in something that's going on to the right side of the screen?
Yes, they look like they're looking that way.
And do you see on the far left what we've already identified before as being Enrico Fiola holding a camera?
Yes.
And can we play that ahead to frame 182, please? This is frame 182. Would you agree that's the still shot that we've seen earlier when you were showing the exhibit? Would you agree?
Yeah, it looks similar to it, yes.
Right, because we see Enrico Fiola here again, right? He's looking towards the screen. We can see the light in his eyes.
Yes.
And he's again holding the camera, correct?
Correct.
And there's, again, this person on the ground, which I believe earlier you identified as being Tyler DaSilva.
Yes, that's him.
And that's Tyler DaSilva on the ground, correct?
Correct.
And then can we play it forward? Just a frame or two ahead.
A frame or two. There's one.
One more.
Let's do one more.
I'm sorry. Can you back that up to maybe 180?
That's behind.
Yep.
We were at 182.
And
It's the same picture we're on.
one more. There we go. Do you see here, again, Mr. Hines with the black shorts, the white trim, and the green top?
Yes, I see him.
What is he doing there?
Looks like he's
Standing
stomping.
over the kid on the ground.
Can we play that forward to 183?
He's stomping on him.
Sir, would you agree that he is kicking that person that is on the ground?
It looks like he's doing something.
Doing something, but you're not sure what.
Yeah, it's hard to tell.
All right. Can we play that forward? And I'll just ask you when to stop her. Thank you. Can you stop? Do you know who this gentleman is that's standing here in the front of the frame with the white shirt and looks like some sort of dark bottom?
It's hard to tell with the light on his face.
Can we play that forward just a little bit more? And again. Stop, please. Any idea who that was?
It looks like someone named Alex Zaborek.
I'm sorry?
Alex Zaborek.
Alex Zaborek.
Yes.
Do you remember him being there that evening?
Yes.
Did you tell anybody about Alex Zaborek being there that evening?
No one was asking me about him.
No one's asked you about him. Can you play that forward again? Can you pause it there? We're at frame 332. Do you see that, Mr. Connery?
Yes, I do.
And do you see here to the left, standing beside somebody with their camera out, Ryan Hines, the white trim, black shorts, green top?
Yes, I see him.
Do you see Mr. De Silva on the ground with his baseball jersey up over his head, hockey style?
Yes, I see that.
Do you see Alex Bernson leaning over him?
Why is that hockey style?
Yes, I see that.
Do you see Michael Sampieri also coming towards him?
Yes.
Is this your brother coming into the frame here from the right-hand side?
Yes, it looks like it.
Can we play that again, forward ahead? And can we pause that? And do you see your brother being followed by this gentleman in the gray top with the dark shorts?
Yes.
Who did you tell us that was before?
Joey Romano.
Joey Romano. Did you tell anybody that Joey Romano was there that evening?
None.
You weren't asked?
No, and no, I was not asked.
Do you see this gentleman here with his shirt off and the dark colored, maybe camouflage shorts?
Yes.
That's Matthew Lokovich?
Correct.
Okay. And he's in a group, you would agree, with Mr. Romano and your brother?
Correct.
Can we play that forward again, please? Can you pause it, please? Do you see right behind Mr. Lokovich a person with white shorts and a dark top?
Yes, I do.
Do you believe that to be Mr. McGrath?
Yes.
Can you play that forward again, please? Can you pause it there, please? And you see Mr. Hines standing to the left of frame 400, correct?
Correct.
Green top, black shorts, white trim, correct?
Correct.
Jacob Villalobos shoving Mr. De Silva, correct?
Correct.
You see the leg and part of the body of Mr. McGrath, correct?
Correct.
And he's standing in close proximity to this group that is shoving Mr. De Silva away. You agree?
Yes, somewhat close.
Can we play that forward, please? Can we pause it there, please? We're at frame 490 now. Can you see that?
Yes.
Where were you located when that was going on?
In the back area where I was saying before, behind the crowd.
Still behind the crowd?
Correct.
Are you laying down at this point?
No, I was not.
What were you watching at this point?
I was just in shock and just staring off.
You still see Mr. McGrath here in frame 490, correct?
Correct.
Where were the rest of those people that were just with Mr. McGrath?
There to the left of him?
You could see them?
No, but just from the last clip before.
You're inferring that they didn't just disappear?
No, they did not disappear.
Just going to hand this back to you.
Okay. Thank you.
Now, is your testimony that at least when you saw Mr. Hines engage with Mr. Valle, that they were just tussling and there was no punches, correct?
They were tussling. I didn't see punches or anything else.
Did you see Mr. Hines kick anybody?
No, I did not see him kick.
You didn't see him punch anybody?
I didn't see punches.
Did you see him tackle anybody?
It wasn't tackling. It was just tussling. I don't know how to exactly describe it, but they were going at each other.
And after you claim to have separated them, did you see Mr. Hines go and do any of the things that we just saw there on the video?
No, I was not looking for that.
You couldn't see any of that?
No, I was not looking for it.
Did you see Faison Teal stomping anybody?
No, I was not looking for him.
And it's your claim or your recollection that you were stabbed even before the video started?
Correct.
I think he's wrong about that.
And it's your claim that there were only 3 people involved in the fighting?
From what I saw, from what I was looking at, the angle I was at, yes.
And that most people are just sitting watching?
From my point of view, correct.
You were dressed similarly to Mr. McGrath that evening?
Different color shorts and no logo shirt.
Dark top?
Yes.
No logo on your shirt?
Nope.
White shoes?
Correct.
Light gray shorts?
Correct.
All of the kids that were there at that party that night, other than the kids who showed up in the pilot, were very close friends of yours, were they not?
Yeah, they were, I wouldn't say super close. Some were closer than others, but they were friends of mine, yes.
Many of them you had grown up with since childhood, correct?
Correct.
You would get together almost every weekend over at Mr. Rich's house, correct?
Not at his house, but we would get together with everybody every weekend, different places.
Different places, but engage in a similar sort of party wherever those places were, correct?
Not every weekend, but here and there, there'd be something to do.
And when you would get together, there would typically be drinking, you told us?
It depended on the situation.
And you wouldn't want to see your friend's reputation or memories be harmed in any way, would you?
No.
After watching that video the way we just watched it, does that change your recollection of anything that you've told us?
No. What I remember is what I remember.
Thank you. Nothing further.
Thank you.
I have questions.
Couple more questions on direct.
Hey, Tom.
How's it going?
Council just asked you about this video.
Correct.
This is frame 252. Do you know who that is by the car?
Yeah, that's Raul Valle.
You didn't see that, right?
No.
At the time?
No.
But you know that now.
Yeah, I know it now.
Can you play the video, please? Stop. And frame 287 on the ground, that's Tyler DeSilva, right?
Correct.
But you didn't actually see that at the time of the video, right?
No.
Play it. Stop. Now, frame 397, who is this individual starting to push Tyler DeSilva out into the street?
Jacob Villalobos.
Go ahead, please. Stop. Now, frame 416, who is that stumbling out towards the street?
Towards the street is Tyler DeSilva.
Who's directly behind him?
Raul Valle.
Do you remember that happening on the night in question?
No.
And who is this individual standing by himself right here on the left side of the frame?
The one with his arm right there? That's Jimmy McGrath.
And was it at this point that you looked over and you saw Jimmy McGrath stabbed?
No, no.
Play it, please. Who's standing out on the street all by himself in frame 453?
Tyler Silva.
That's not the defendant right there?
No, that's not the defendant.
Wait, please. Now, this individual on frame 489, who is this right here?
I'm sorry, you're blocking my
Frame 489 on the left side of the frame.
That's Jimmy McGrath.
Okay. Standing all by himself?
That's what it looks like.
Do you remember seeing this happen on May 14th of 2022?
I saw him standing by himself, but after they drove away.
Okay. Please play it. Frame 533. Do you see Mr. McGrath?
Yes, I do.
What does he appear to be doing at this moment?
He's backing up away from something.
Did you see that happen on May 14th?
No, I didn't see that.
Who is next to Mr. McGrath in this frame?
Tyler Silva.
So you remember certain things happening that night, but not everything that you saw in the video.
Correct.
Is that correct? Safe assessment?
Yes.
So at what point in time do you remember seeing Mr. McGrath after you realized you're stabbed?
So after I realized I was stabbed, they have already driven off, and actually he was standing somewhere near where he is in this video, and that's when I saw him stabbed and fall to the floor.
You saw him lift up his
He
shirt?
pulled up his shirt, there's blood, and he just dropped.
Now, counsel asked you a little bit about you giving a statement to the police about the defendant making eye contact with you just prior to him coming towards you and hitting you in the leg, right?
Correct.
Describe why you said what you said.
Because the way he looked me in the eyes, no one's ever looked at me that way before. And it was, now when I think about it, the punches that I thought were being punches was someone who looked at me knowing what they were going to do.
So how would you describe, withdrawn, when he looked at you, is that the moment that he came towards you?
Yeah, we made eye contact and then we engaged.
So describe how, when he made eye contact with you, how he engaged you.
He was on literally bent over, as I described before. He looked me up right into the eyes, and I looked at him, and then he came right at me with the leg, and that's when he was doing the hooking motion into my leg.
And when he came at you, what was your reaction to that?
I immediately was doing the thing, get off, like this.
Okay. And when counsel asked you the fight just stopped, what did that mean, the fight just stopped? It didn't just stop.
Me and him had our separation, and then that's when I stood there in that back just looking around in shock.
And when you were in shock, were you, what were you doing? Were you focusing on what was happening?
I think I don't recall exactly what was happening around me because my body was just telling me, like, you're hurt, figure out yourself. So I was just sitting there, standing.
Were you engaged in who was around you and taking notes on all your friends around you?
Not at all.
So when counsel asked you, was Matt Lockovich there, and you said you can't recall, why did you say you couldn't recall?
Because that night I was not thinking, where is Matt Lockovich right now at this moment?
And when he asked you where Mike Samperi was at any particular moment, why weren't you?
I wasn't thinking, where is Michael Samperi?
And how about where your brother was?
I thought I already had pulled my brother out.
And what about where Jimmy McGrath was?
I wasn't thinking, where is Jimmy McGrath right now?
And how about any of your other friends that have been mentioned?
Not a single person I was thinking about, no, not where they are.
So with regards to when counsel asked you about when the car initially drives up and people say someone's out in the front yard or the car's here, and you walk out into the driveway, but you stand at about, I think, 30 feet away. How many people were around you that were from the Shelton party?
Like I said, there was 10 people in the driveway around me.
How many people were close to the car?
About another 10.
And at that moment, were you taking notes about who was to the right of you, who was to the left of you?
Not at all.
Why weren't you taking note of that?
Because I was taking note of who were the people that were not supposed to be here in the car.
Okay. So where was your main focus at that point in time?
The people in the car.
And with regards to when you go back into the house and then you come back out a second time, remember when you just testified and crossed that the car was down the street and you come down the tree line area?
Correct.
So I think your testimony, this is State's Exhibit 49, testimonies you were somewhere down near the second red bush towards the street.
Yeah, correct.
Down the street. You remember what counsel asked you about? Do you recall Faison Teal was in the yard at that time?
Yes, I remember that.
Do you remember what your response was?
No, I did not see him. I do not recall seeing him.
Why didn't you see Faison there?
I wasn't in the yard. Hey, where's Faison Teal? Thinking that.
But was Faison Teal at Tyler Rich's house?
Yeah, he was at the party, yes.
You just can't recall whether or not he was in the yard at that particular moment?
No, I cannot recall.
Could he have been at the yard?
Sure, he could have been, yes.
Maybe you didn't see him?
I wasn't looking for him.
So with regards to anybody that may have been around you, in addition to Faison Teal, again, was your focus on your friends around you or what was happening down the street?
I was looking down the street. I wasn't thinking who's next to me in this moment.
Now, with regards to one final question. Counsel asked you about this picture. State Exhibit 57. Recall that?
Yes, I do.
Do you know where that picture was taken?
Yes, I do.
Where was that picture taken?
Mr. DeJesus' house?
You didn't take that picture, right?
No.
How do you know that this is Mr. DeJesus' house?
I've been over there before.
Okay. And when you say Mr. DeJesus, who are we talking about?
The father, the person who owns the house.
Okay. Do you know if Mr. DeJesus has any children?
Yes, he does.
And who are his children?
He has 3 boys and 1 daughter.
And are you friends with any of his
yes, I am.
children? Who are you friends with?
Nick DeJesus through my brother, and then Joey DeJesus because he's older than me.
And was any of those individuals at Tyler Rich's house then?
Yeah, Nicky was.
Nicky was?
Yeah.
Okay. So when you're referring to Mr. DeJesus, who's 50-something years old, you're talking about the father, not the son?
Yeah, the father.
Okay. All right. All right. Thank you. I have no further questions.
Thank you.
You were just asked about when you had been out in the driveway looking across the way. There were 10 of you in the driveway, you recall, and another 10 across the street with the car, correct?
Correct.
And you told us you were just focused on who was in the car that wasn't supposed to be there, correct?
Correct.
And that's why you didn't see anybody rocking that car, correct?
Correct.
That's why you didn't see anybody put their hands on that car, correct?
No, I did not see that.
That's why you didn't see anybody throw anything at that car, correct?
No, I did not see that.
That's why you didn't see any of your friends do anything to that car that night, correct? Because
no, I did
you were
not see
just
that.
focused on who was in that car.
Correct, I was focused on who was in it.
So focused that from 30 feet away, you could tell us, despite the 10 people being in front of you, that Jack Snyder was the driver and Mr. Valle was a passenger, right?
Yeah, I had a sight on them. I looked at them, and that's what I acknowledged.
Thank you. Nothing further.
All right.
When you noticed the defendant and Jack Snyder in the car, did you hang out there the whole time or did you make your way back into that?
No, I went inside.
Okay, so you didn't stay outside the entire time during that?
No, there was already so many people out there. I didn't need to be out there.
No further questions.
Nothing further.
All right. All right. You're dismissed. Thank you.
Wow.
Just watch your step as you exit, okay? Thank
A
you.
little bit hostile there, that witness, not remembering anything helpful to the defense or anything that would be harmful to any of his friends who were there, although he
Attorney
acknowledges they were all
Messina,
there.
State's ready.
Dr. Rosella on the stand, please.
Thank you.
So, doctor, do we have a medical examiner coming up? That's our defendant right there. I believe he's 20 now. This happened when he was 16. He was stabbed, but he thinks he was stabbed early on. Everyone else says that the defendant ran to the car, got a knife, and came back,
Yes,
and then they
please
said
step into the witness box and remain standing.
So
Madam Clerk, to my right, will put you under oath.
This story doesn't match
Thank
up.
you.
Please raise your right hand. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you shall give concerning this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or upon penalty of perjury? I do. Please state your full name, spelling your last name.
Roselle Crombie, C-R-O, M as in Mary, B-I-E.
Thank you. And please state your business address.
My business address is, it's 888 White Plains Road, second floor, suite 206, Trumbull, Connecticut, 06661. Thank you. You may be seated.
Hi, Dr. Crombie. How are you today?
Good afternoon, Tatiana.
Good afternoon. It's a little bit difficult to hear in this courtroom.
Okay.
So as much as you can keep your voice up, we appreciate it. So thank you.
Absolutely.
Dr. Crombie, what is your current profession?
I am a surgeon.
Okay. And explain to the members of the jury what degrees you hold.
I hold several degrees. I have MD, MPH, which is a Master's in Public Health. I have a FACS, which is a Fellow of the American College of Surgeons, and FABA, which is a Fellow of the ABA. I'm double boarded in general surgery and surgical critical care, and I am fellowship trained in burn surgery, which is traumatic burns and reconstructive plastics.
And what hospitals are you affiliated with?
I'm part of the Yale New Haven Health System. My primary home hospital is Bridgeport Hospital, but I do also at times go down to Greenwich Hospital. And many years ago when I first started, I was at Yale New Haven Hospital.
In Bridgeport Hospital, that's located in Bridgeport, Connecticut?
That's correct.
And how often are you at Bridgeport Hospital?
At this point in my career, most of my practice is outpatient ambulatory surgery that's done at Park Avenue Medical Center. And then I'm on service, meaning in the hospital to cover burns a certain number of weeks per year. But about once a week, I cover on call, which means that for a period of time, my surgical group has to cover trauma, general surgery, surgical critical care, burns, and wounds over a period of time. It's typically a 30-hour shift.
And for how long have you been affiliated with Bridgeport Hospital?
I'm at the end of my 16th year of practice, so it's been a very long time.
And if you can give us a rundown of your work experience.
My work experience, it's all of those specialties, in addition to some outpatient and ambulatory surgery as well. So it's general surgery, burns, trauma, critical care, which means people that are sick or very sick on ventilators, need a lot of vitals. I do wound surgery. I do a lot of reconstructive plastics as well.
And could you please explain to the members of the jury in what capacity your expertise is needed at Bridgeport Hospital?
Primarily for burns is what I'm renowned for. If you look up my name nationally, but additionally, again, I do reconstructive plastics. I cover trauma when I'm called to about once a week.
Says,
whenever it comes in through the emergency room that needs addressing by a surgeon at certain times.
In your specialty of trauma, explain to the members of the jury, are you in one particular department at Bridgeport Hospital, or are you called into any department when needed?
Good question. So a lot of the general perception is that we're just sitting there in the emergency room, and that's exactly not what happens. So I'm a surgeon. I'm part of the Department of Surgery, Surgical Critical Care, General Surgery, Burns, Wounds. I know I keep repeating, but just to stand the point, when there are different types of consults that come throughout the hospital or outside of the hospital, and we're called to either different floors or different sections of the hospital, then we go and we see the patient and we evaluate them. Sometimes it's up on the 10th floor where there's a cardiology issue. Sometimes it's in GI or gastroenterology. Anywhere where there is a need for either any of those particular specialties that we cover, that's where we go. And the emergency room obviously is one as well.
Have you testified in court before?
Multiple times.
And do you have any teaching responsibilities?
I do. I'm faculty at Yale School of Medicine, Department of Surgery.
Oh, in your spare
time? Does that involve
time?
teaching residents?
It does, yes. Whoa. Many residents, about over 100.
Do you belong to any professional societies?
Multiple professional societies. So the American Burn Association, the American College of Surgeons. I also belong to a number of wound societies as well. I'm chair of the Physician Special Interest Group for the American Burn Association. I am on I'm a board director at large for the American Board of Wound and Surgery, effectively. I'm the chair of a conference that's called the John Boswick Symposium, named after a former burn surgeon. So I do quite a bit at the national level and also within the state of Connecticut, the American College of Surgeons within the state of Connecticut.
I'm going to direct your attention to May of 2022.
Yes.
Do you recall working at Bridgeport Hospital at that time?
I do.
And at any given day or night, how many patients would you see?
So I'm on call tonight. I was on call Saturday. I'm typically the Tuesday person or the Saturday person. It can be anytime, anywhere between typically 17 and 20 consults, and then I'm covering about 60 to 65 patients that are on the floor. In addition to that, if anything emergently needs to go to the operating room that needs to be addressed, then I'm also operating on that as well.
What you just recounted, was that about the same way in 2022?
That's a typical night on call for me.
And directing your attention specifically to May 15th, the early morning hours, May 15th of 2022. Do you recall working at Bridgeport Hospital on that morning?
I was the overnight person, yes.
And overnight, what hours is that again?
So we usually, in addition to working a regular day, which for me starts about 7 a.m. operating, at about 4, somewhere between 4 and 6, I have to come back to the hospital and relieve my partners that have been covering the hospital. And then I cover all of those services until about 8 a.m. the next morning. So it covers the overnight shift effectively. Each one of us takes our turn. That happened to have been my turn.
Did there come a time when you examined a patient by the name of Thomas Connery?
Yes.
And do you recall reviewing Thomas Connery's medical records before testifying here today?
I did.
May I approach counsel, Your Honor?
So he was the previous witness, right? Thomas was our last witness, the victim. So she's the treating physician, or surgeon in this case. She's like, yeah, he kept complaining, wanting stitches. I'm like, you're going to be fine. He's like, I'm going to bleed to death. You're going to be fine. Fine, I'll give you 2 stitches. This is that lady. She does 20 people's jobs by herself every day in 30-hour shifts.
I'm going to be showing you what's marked as State Exhibit 81 for ID purposes only. Just please review this and let members of the jury know, what is that document?
This is the medical record of the said patient, Thomas Connery. It gives a medical record number, which is a number within our Healing Heaven Health System and a date of birth, 11/27/2023, and it is the contents of what is taken out of our electronic chart now since 2015, but the government required us to be electronic and it's printed into paper.
Were those records made in the regular course of business at Bridgeport Hospital?
Yes.
And is it in the regular course of business for Bridgeport Hospital to record such documentation?
It is.
And you had an opportunity to review these records before coming to court today?
I did.
And are those records the same records that that were generated on the date of service, which was May 15th?
That is correct.
And are these records certified?
Yes.
I'd ask that to be marked as a full exhibit.
No objection, Your Honor.
All right, court will accept into evidence dates 81 full.
This doctor is up during her sleep time before she goes on a 30-hour shift.
Dr. Cromley, giving you back States 81. Now, full exhibit, you can now reference States 81. Dr. Cromley, looking at States 81, when was Thomas Connery admitted into the hospital that morning?
5/15/2022. I recall that it was just at the turn of midnight is when we got paged.
Okay. And to your knowledge, how was he brought to the hospital?
By ambulance.
And where was he brought upon his arrival?
In the ER, there is an ambulance bay where the EMS providers bring them down the hallway and it goes into a trauma room. We have 3 of them, and effectively they're just big rooms that have a lot of equipment that we might need for emergencies or anything that we need to do.
When Thomas Connery arrived, did he arrive as any kind of specific level, meaning a trauma level or something otherwise? And how do you know this?
So the American College of Surgeons and the American Association of Society of Trauma, they grade the levels of trauma on 3 levels. So the lowest one, meaning that you can just consult the physician, it's not emergent. The second one being that there are some injuries that may be concerning and we require certain people to be there. And then the top level, which means that the patient is an extremis. Everybody should be there, including respiratory anesthesia, surgery. Everybody that is needed possible. It denotes a call to the blood bank, et cetera, et cetera.
Do you know what level Thomas Connery came in as?
I believe he was a trauma alert, which is the mid-level.
And from your experience and expertise, why was he labeled as a trauma alert?
So per the criteria of the American College of Surgeons for certified verified trauma centers, because he had a penetrating injury of some sort, he immediately bumps up to at least a second level, maybe even a third, depending on a bunch of different factors.
Would that be for all patients who come in with similar injuries such as his?
Penetrating trauma does trigger the second level.
And please explain to the members of the jury how you came about, how you were asked to assess his injuries. How were you called to assess his injuries?
So in a typical night on call, I'm the attending on call. I have a chief resident, which is anywhere between a PGY3 and a PGY post-grad year 3 to post-grad year 7, basically. And then there's a mid-level resident, which is the person that primarily covers any consults that come through the ER or any emergencies like this, and then an intern. So what typically happens in many hospitals throughout the United States is that the mid-level or the consult resident goes and evaluates the patient. There's also a separate residency program called the Emergency Medicine Residency Program that also evaluates the patient. And it's part of both the learning process and the incredible need to have multiple parts to patients' care in medical care. And the mid-level resident, we all got the page. The mid-level resident then speaks to the chief level resident, and then they evaluate the patient and call me and give me a head to toe. And then I go and examine the patient.
I'm going to direct your attention to State's Exhibit, I believe it's 81. Page 2, under where it says History Chief Complaint. Can you please read what it says under that line?
Stab wound, multiple stabbings to the left thigh, trauma alert called at 0042, so 12:42 a.m., direct to trauma 4, which is one of our main trauma rooms.
Is that trauma room was 4?
Correct.
And how many do you have at the trauma?
We have 3 that are active, but we can spin to more than that if needed in a mass casualty incident.
I'm going to direct your attention to States 81, page 6, towards the bottom of that exhibit under the heading ED Notes by Messer Marissa RN. Can you please read what it says there, starting with the sentence on assessment?
So on assessment, the patient with 4 puncture wounds to the lateral aspect of the left thigh, inferior and superior wounds with hematoma, bleeding controlled, pedal pulses present bilaterally. Cardiopulmonary monitoring initiated, VSS, which means vital signs stable. GCS is a measure of the activity and movement and response of the patient. IV access established in the right AC, which means antecubital, which is the inner part of the arm. Lab work collected. Please refer to the trauma narrator for further documentation.
What does all of that mean that you just read?
Okay, let me break it down. The assessment we do, there's parts of a note in the way that we communicate in medicine, which is basically, and the medical students and the residents, they evaluate by hearing the history first, and then by doing a physical exam head to toe. And then there is an assessment, meaning based on the description of the history, the physical exam, and examination of all of the imaging labs, et cetera, what is your assessment? So this is the individual that wrote this, who is a nurse. This is what she is reporting as her assessment for this patient. So 4 puncture wounds, so 4 stab wounds, lateral aspect of the left thigh. So there's laterality, so there's left and right. Lateral means to the outside of the body. Medial means to the inside of the body. So it appears that there were 4 puncture wounds to the lateral aspect, so outside of the left thigh. Inferior means, again, inside. Superior is above, so towards the top, with a hematoma, which is basically a collection of clotted blood. Bleeding is controlled, it appears, is what she is assessing. Pedal pulses means that she touched, or somebody touched, the bottom of the feet and examined the arteries there. And what that indicates is that there's good blood flow that goes beyond those stab wounds to the feet. And cardiopulmonary monitoring was initiated, meaning that they hooked them up to the monitor, which is blood pressure, O2 saturations, respiratory rate, amongst other things. Vital signs are stable, so they fell within a specific range. GCS is a Glasgow Coma Scale. It is a universal way that in the emergency room and surgeons communicate, and it's based on eye movement, verbal, and then overall movement. And there's a score, 15 is the best that you can get. The minimum we typically give if somebody is even deceased is a 3 because they got basically a 1 for nothing. IV access means that the nurses were able to put the IVs in the right arm, and then they collected the typical blood work that we do.
Thank you.
You're welcome.
Referring you to State's Exhibit 81, bottom of page 6 into page 7. Is this where your notations begin?
This is part of my note. Yes.
Okay. And is that your electronic signature on this documentation?
It is.
Okay. And you personally examined Thomas Connery,
I did.
correct? And on that same Exhibit 81, where it says pre-hospital information, what does that refer to?
Pre-hospital information means that before they got to the hospital and rolled in, emergency medicine services are also providing some type of medical care, and they're documenting that in some capacity. Now, I don't see anything other than when the patient rolls in. So I know nothing about whether or not that's valid or invalid. It just is.
And emergency medicine services, that's EMS?
That's correct.
Okay. And it indicates here on States 81, page 7, arrival time and exam time. Is that when you actually examined Thomas Connery?
No, as I stated before, the way that it works is based on the grading of the system. He is a middle grade, so I don't technically need to examine him for a certain period of time. If it's the highest grade, we have to be there within 15 minutes.
Moving to page 8 of States 81, what is the difference between a primary survey and a secondary survey that is listed there?
So again, with the American College of Surgeons and the trauma, a primary survey means primarily we're identifying the things that can kill you. So airway, breathing, and circulation. And so those are the primary survey that we have to evaluate. Airway, I'll give you for an example. So if airway is not working because they don't have a breathing tube in, you stop there. You cannot move on to identify whether or not they're breathing because they may not stop breathing until you have an open airway. So that's the time that we get anesthesia to come in, put a breathing tube. And then you keep going down until you're done with circulation, evaluating all the vessels throughout the entire body and making sure that they have good pulses. The secondary survey is then after you've got the patient stable and you've got all that documentation is really looking at things like eye movement. Do you have blood in your ear? Are there any other deformities because of fractures and stuff like that? So that's all documented as a methodical way so that nobody misses anything.
Now, prior to assessing Thomas Connery that morning, had you had occasion to treat patients with stab wounds in the past?
I have.
And upon examination of Thomas Connery, were his wounds consistent with stab wounds to the thigh?
They were.
And do you base your conclusions on self-reporting, your personal observations, or a little bit of both?
In terms of that they were stab wounds? So it's a little bit of both, but there are also some imaging studies that are done. And within the imaging studies, things that we're looking for are communication of air into the deeper tissues. And he did get what we call a CAT scan. So it's evaluation of the actual soft tissues and bones that showed that the injuries on the skin were consistent with a deeper injury down below.
I'm going to direct your attention back to States Exhibit 81 on page 9. Are those notations a continuation of your secondary survey of Thomas Connery?
They are.
And directing your attention to page 9 under where it says extremities. If you can please read that to the jury and then explain why this was concerning to you.
Sure. So this is an evaluation of the extremity on the secondary survey. Left thigh with 4 stab wounds with no active exsanguination, meaning no active bleeding at the time when we saw him. Inferior anterior stab wound, again, that's the inferior, so inside in the front anterior stab wound with a small hematoma, so small clotted blood. Range, ROM means range of motion intact at the hip joint, knee joint, and with the foot, meaning that his hip, his knee, and his foot moved completely normally for what we would expect of this age. No focal neurological deficits, which means that we tested both motor and nerve, and it was equal to the other side, and there was nothing missing. No vascular deficits, meaning that they were palpable with the different pulses, femoral, popliteal, dorsalis pedis. These are all anatomic as we're working down from the hip all the way down to the foot with an ABI of 0.94. Distal pulses palpable and symmetric, except for, as noted above, no gross deformities or bony tenderness of the extremities, normal passive range of motion, meaning that there wasn't anything inhibiting us from bending his legs, of the extremities without pain, except noted above, no abrasions, lacerations, contusions, ecchymosis, hematomas, or foreign bodies were noted on the physical exam. I just also want to point out the ABI, which is stands for the ankle brachial index, is another completely subjective where we measure the blood pressure at the brachial, meaning arm, and the ankle index. It should be equal and bilateral on both sides, and it should be 1. There are some elderly patients that have some vascular disease, meaning that they have smoked or they've got atherosclerosis. Sometimes you can have a decrease between 1, but in a normal young man, such as it should be close to 1. So in the area where the stab wound was on the left thigh, that limb was slightly decreased.
Why was it alarming to you?
So when you cut through a muscle, and if you think about it like a steak on end, there's a white thick tissue on the end called fascia. And what that does is as you injure the muscles, which are very vascular with a lot of arteries and vessels and lymphatics, they can swell to the point where it swells within that tight vascular tissue, that tight tissue called the fascia, and it can actually compress important structures like veins, nerves, and arteries. So that's why that number was concerning to me, because A, in a young man, it should not be less than 1, and B, it just shows that there's a significant amount of hematoma, meaning blood, that was starting to decrease some of the flow that was adding to our measurements.
In your professional expertise, would that be something that would be life-threatening, a life-threatening?
It can be life-threatening, and it also can be limb-threatening for a young man. So limb-threatening, meaning that as it starts to compress some of those arteries and veins, what happens is effectively it decreases the perfusion or the carrying of blood to the areas distal or further away from where the blood comes. The blood comes from your heart, it comes down into your hips where your femoral artery is, and then it goes out to the furthest point in the lower extremity. And what can happen is if the thigh's pretty muscular, if you continue to bleed, you can actually squeeze to the point where no blood flow is going down to below the knee or below where the thigh is. So that can typically in a non-responsive patient end up being an issue. And even in a responsive patient, it can lead to something called a compartment syndrome, meaning that the compartment is so tight that the pressures in the different area are damaging key structures. And that can ultimately, obviously, we call it ischemia, meaning not blood flow to a limb. And if it's not dealt with in a timely fashion, it can be devastating.
Now, directing your attention to page 11 to page 12 of States 81, at the way bottom of that page where it indicates soft tissues, there's a subcutaneous gas noted within the soft tissue of the anterior lateral thigh, best visualized on lateral view. What does that indicate?
That means kind of like I was describing for the CAT scan before. It just means that there was a communication between the outside air and the inside air. And what happens is, you can imagine, is just when I kind of akin it to like if you were cutting like gelatin, the knife goes in and there's parts of it that will close, but there's going to be a track of air that communicates with the outside that basically is illustrated by this picture.
And that would be indicative of a knife penetrating.
Some sort of, not specifically a knife, but a penetrating object.
At the very end of page 12 in States 81, it indicates attending comments that Thomas Connery was admitted for observation as the thigh muscles are highly vascular. Why was it important to keep Mr. Connery for a little bit of time at the hospital?
To make sure that he wasn't going to continue to bleed to cause that ultimate demise of what I was alluding to before, called compartment syndrome.
And at some point in looking at I believe it's page 14 of States 81, there's a notation there from the nurse that indicates that at 3:15 a.m., dressings found to be drenched in blood, dressing changed with Sarah, who was one of the nurses. Is that a notation indicating that the wounds that Mr. Connery had sustained were still bleeding even
That's
after
correct.
several hours?
That's correct.
Dr. Crombie, are you aware of Thomas Connery blood was taken to be tested for anything at the hospital?
It's very standard for all trauma patients to have their blood drawn.
Standard, and why is that?
Because we are looking for not only to see how physiologically deranged they are, because often, despite the fact that our EMT providers are excellent, it just gives us a better clinical picture of what we need to do. But additionally, related to that, it gives us a little bit of an insight into some of the substances that may be masking some of the physical exam symptoms and the radiologic symptoms.
Direct your attention to page 23 of SAFE 81. It does indicate that Mr. Connery's blood was tested, and it was tested for ethanol, which is alcohol. Do you recall what the level was?
125.
And what is that for BIC?
So blood alcohol level is a way for us to measure how what the law has deemed as being impaired, and 0.8 or 80 milligrams per deciliter is what's considered the impaired amount. I mean, obviously that's going to vary depending on your body mass and et cetera, but that's what's legally done. So technically at 125, he has an alcohol on board, and it's significant enough to cause impairment.
Is that a BAC of 0.125? Would that be the conversion?
0.125, yep.
He was more than 2 beers in.
So the fact that Thomas Connery had alcohol in his system, would that have affected his injuries or how he was treated at all?
So full disclosure, we don't get these numbers right off the bat. Like, this is something that comes afterwards, but it is incredibly helpful when it comes afterwards that then the team knows that they need to give more fluid and that the alcohol might be affecting the type of injury that he has. More specifically for him, it's just that he is intravascularly, so he bled, and then he's intravascularly dry because of the alcohol, because alcohol is a diuretic. It actually signals, it overrides your kidney's normal homeostasis or balance and doesn't allow you to reabsorb the water when you're dry. It actually signals for you to pee, and that will make you drier effectively. So that's the significance of that in him.
Okay. Being that you did not have these levels beforehand, did you see anything that was concerning to you that you thought maybe he had alcohol in his system, hence causing more bleeding, or he wouldn't heal as fast because he had alcohol? Anything to that effect?
No, that shouldn't affect it.
Dr. Cromie, I'm going to show you what's been marked as, one moment. It's exhibit 77. Can you see that on your screen over there?
I can, yes.
This was a picture that was taken at the scene.
At the scene.
Do you recall if this is similar? Mr. Connolly was taken.
It is similar.
Okay.
So we don't see these pictures, obviously, unless EMS has it.
Right.
I just see the patient as they roll into the emergency room.
And I'll say one moment, Your Honor.
Sure.
Showing you with the marked state 73. This was a photograph that was taken of Thomas's injuries about a week after, I believe. Are those consistent with where you saw the wounds the night in the morning?
Correct. They are consistent. So left leg, and you can kind of delineate that because there is another leg underneath it that shows the right leg. Lateral is the outside of the leg, like I was saying, and those are 3 of them. There was one on the other side. So when we talk about this is the lateral, the opposite of that is a medial. There's clear description throughout the chart multiple times of an inferior medial one as well. And the significance of that means that the object, whatever it was, went through and through could have gone through and through to the other side. And that's the concern that I have as a surgeon.
So pointing to this exhibit, indicating here, I don't know if you can see that. Which injury was this? You termed it as?
It should be superior lateral.
Okay. And pointing here to the middle exhibit.
That should just be lateral or anterior lateral.
And pointing to the lower end.
It's technically inferior lateral because it's still on the outside of the leg.
Okay.
Yeah.
And the one we're not seeing here in this safe exhibit is, you said, on the inner thigh?
Inferior. So inferior medial thigh. So inside thigh.
Now, Dr. Crombie, referring you back to States 81, page 12, under assessment plan, what does it say was initially done to help heal or tend to Mr. Connery's wounds?
So the wounds were washed thoroughly with betadine, which is an antimicrobial, and saline, which is effectively salt water. Xeroform gauze, which is a yellow gauze that has some bismuth salts in it, was applied and secured in place with Carlix dressings, which are the types of gauze that you can kind of wrap around a leg.
Why weren't sutures used? Stitches?
Good question. So I don't know what he got stabbed with. It could have been a branch for all I know. And that is not sterile. That's got a ton of bacteria, a ton of stuff that might still be in the wound. So you do not want to close the wound, because then what that allows is to have growth of specific bacteria that are not, they're called anaerobic bacteria. So they thrive where there's no oxygen. So we always leave stab wounds open when we don't know what it is, how deep it was based on the imaging. So it heals from the inside out. So you just need to clean them, irrigate them out, and allow them to heal.
If Thomas had told you or told one of the nurses that he had gotten stabbed with a knife, would you still have not put sutures? So even if it was a knife, not a tree branch as you indicated, would you still have had the same course of treatment?
Yes. I don't know how clean the knife is.
Okay. And I'm going to direct you, well, withdrawn. To your knowledge, do you know how long Thomas Connery was in the hospital for?
I don't know. I know that he came in around 12:54. I know that the dressings were changed at 3:15. That's why my note and my attending note doesn't match my residence note, because I wanted him to be observed. So, and then what happens is 8 a.m. is there's a new team and a new partner of mine that comes and takes over.
But you do know that he was kept for some time for observation?
He was.
Dr. Crombie, I am going to ask you, in addition to treating Thomas Connery that night on May 15th of 2022, did you also recall tending to a patient by the name of James McGrath?
I did not know his name at this time, but yes.
And do you have a clear recollection of when James McGrath was brought into the hospital on May 15th of 2022?
Yes. So in my recollection, the way that we kind of describe it in the surgery team is they both came in around the same time. What we have to do is identify and treat the more critically ill patient, which was, he was unidentified at that time.
Is it safe to say that James McGrath you tended to him prior to tending to Thomas Connery based on the level?
Correct.
Of the critical care?
So he came in as a trauma code, which is the highest level. So anesthesia was there, I was there, everybody that I mentioned earlier was there.
And how did your team initially know that he was coming into the hospital? Was it an alert that you had gotten from EMS?
So throughout the emergency room, and again, we're not there, there's something called CMED, which is a radio system that the EMTs and the paramedics and the ambulances do to basically triage and give a heads up for the patients that are coming into the emergency room. They had given them a heads up of the nature of how in extremis he was, how much blood there was on the scene. So that automatically bumps him up to a trauma code. So the way that I'm notified is I get on my pager, it says trauma code and gives a very brief description of what it is.
Okay. And why did he come in as an unknown? Explain that a little bit.
Oh, that's just if there is nobody at the scene that can identify them, very well, that's one reason. The other reason is it's unclear whether or not he's a victim of violence, and we also want to just make them an alias and be unknown so that we can just focus on that and not have to worry about all the other stuff.
Prior to coming today, did you have an opportunity to review medical records for James McGrath?
I did.
And when he came in, do you recall what his appearance was?
Very pale and white, and he was on a Lucas machine, which is an automatic machine that performs CPR. There is a plunger that goes over the chest, and then there's an archway where they put the patient's arms to, and it's Velcro too. And the EMS can start and stop, as can the team. This Lucas machine is what it's called. And that allows the EMTs or the paramedics to focus on things such as fluids, managing his airway, et cetera, things that need to be done, yet CPR is being performed.
If it's noted that his appearance was toxic looking, what does that refer to, or what does that mean?
The nurses say that if for some reason the patient looks like they're either dead or imminently dying, but very sick, not good.
Do you know what the acronym ETT refers to?
Yes, endotracheal tube.
And what is that?
That is the breathing tube that gets put into your airway when you can't breathe for yourself.
And the term asystole, what does that refer to?
So there are different types of heart rhythms. Asystole means that there is no electrical activity that the heart is actually showing nor is there any waveform that will transduce to the heart to be able to give meaningful pumping to circulate your blood.
From both your personal recollection as well as your review of the medical records of James McGrath, when patient presented, do you recall what type of a stretcher he was in?
He was in a bucket loader stretcher.
And what is that?
So backboards are typically flat. If you've gone to any swimming pool, you've seen it on the side there, and it's to allow people when they fall down, emergency people, to be able to slide them onto some sort of board and fix their neck and make them secure and seatbelt them in. I don't know why he was in a bucket loader. I'll be honest with you. Maybe there was a lot of things going on at the scene, and that's the only stretcher that they had. But they scooped him up into that, and then they put him onto the regular rolling stretcher. So they brought him in, and we moved the bucket loader over to there's another, so the ambulance, stretcher that fits in the ambulance comes in, they put it side by side with the emergency room stretcher, and then they move the patient over, whether it be in the bucket loader or typically just the backboard, over to that. And then we try to take the backboard off, but he was in such extremis that we didn't even, it was just really scoop done all the way into and continued CPR.
So you immediately started working on him without even taking him out of the bucket?
There was no stoppage whatsoever.
Now, the term ED disposition, what does that refer to?
So at the end of the evaluation of care, sometimes we have to decide where we're going to put the patient. So like, for instance, somebody that needs ICU level care, their ED disposition is to the ICU. If they need to be admitted and they are floor level care, meaning they're not as sick, they don't need intensive care, then they go to the surgical or medical floor.
If it says ED disposition expired, what does that refer to?
So that means that the patient is deceased.
May I approach counsel, Your Honor? Dr. Crombie, showing you what's been marked as stage 82 for review purposes. You recognize this document.
This is the medical chart of Mr. Unidentified, who's now identified as James McGrath from 5/15/2022.
Did you have an opportunity to review those medical records prior to testifying here today? And were those records made in the regular course of business of Bridgeport Hospital?
They are.
And is it the regular course, is it the regular course of business for doctors and nurses at Bridgeport Hospital to generate such a report when treating a patient?
It is.
And are they under an obligation to record information accurately?
They are, and I am.
And is it a certified documentation?
It is.
I would like to get this marked as full exhibit.
No objection, Your Honor.
All right, court will accept into evidence states Exhibit 82, full exhibit.
Dr. Crombie, I have a few questions just to ask you about state 82, that full exhibit. Let's reference those. Direct your attention to states 82, page 13. Is this where your notes begin in attending to James McGrath?
So it's page 13, halfway down the page. This is my history and physical note that is written after the event occurs.
And page 15 into 16 of that exhibit, attending comments. Just before
That's
that
me.
page. That's you?
Yes.
Okay. And if you could just please read what it says at the bottom there.
From my attending comments?
Yes.
Patient came from over 20 minutes away and clearly was on scene for greater than 20 minutes prior to that per EMS. The patient remained in cardiac arrest, meaning his heart had stopped per EMS and no other rhythm other than asystoles, which is what I described to you before. Since they had picked him up, a significant amount of blood was described at the scene. Head to toe exam, his pupils were fixed and dilated and non-reactive. Stab wound noted in the left chest axillary region. No other injuries were noted on the secondary survey. Patient was intubated. However, there was clearly food substance near the ET tube as he vomited on intubation per EMS. End tidal CO2 was confirmed and placement was confirmed of the endotracheal tube. Upon turning off the Lucas CPR assist device, there were no pulses noted in any of the proximal carotid or femoral areas. Asystole was confirmed multiple times between the Lucas device and self-performing CPR. One round of ATLS, ACLS was done to include treatment as well with bicarbon calcium in addition to the epi that was given. No return of any signs of life were noted. Again, it is confirmed on the monitor that he was in asystole, and an ultrasound evaluation of the FAST reveals no cardiac motion, so time of death was called. Father was told of the condition of the patient.
Referring to page 14 of your notes, where it indicates under chief complaint HPI, where it indicates patient was reportedly found on scene in extremis with asystole as his read. What does that mean?
So meaning that the first note of what the EMS does is they have their own monitors that are portable monitors, and when they hooked it up to his chest with all the leads in the proper area, there was no cardiac rhythm whatsoever.
And EMS, and he presented in extremis 30 minutes after starting CPR. On arrival, he had a GCS of 3. What does that refer to?
So that is the Glasgow Coma Scale that I was telling you about earlier, and it's an evaluation of eye, verbal, and movement. So his eye exam was not moving, he was not talking, and he was not moving. So that's a 3.
No palpable central pulses. That's pulses anywhere.
So central specifically means that the first place that your heart pumps to is your carotids, which are the 2 big vessels in your neck, and then your femorals, which are down in your groin.
And bilaterally dilated unresponsive pupils and ongoing CPR.
So what that means is when the brain does not have oxygen for a period of 3 to 4 minutes, you start to lose, your brain dies and you lose the ability to react to light. And that's seen typically in exactly this fixed and dilated unresponsive pupils.
Directing your attention to page states, I believe we're on 82, page 15 of James McGrath's medical records under trauma bay events, where it indicates resuscitation, those 4 bullets underneath.
Yes, so epinephrine times 2. So they gave adrenaline, which is a drug that we typically give that is naturally occurring in our bodies in the adrenal gland to try to kickstart the heart. He was given 2 times with continuous CPR. No ROSC achieve means that there were no spontaneous live events that were return of spontaneous circulation was not achieved. Cardiac ultrasound, we have a ultrasound in the trauma bay that can look at a bunch of different things, but we specifically looked at the heart and it was not moving whatsoever. And then patient declared dead at 12:52 a.m.
Dr. Comey, who declared James McGrath dead?
It was technically my resident, but I was there supervising.
And do you recall who went out to tell James McGrath's father that his son had passed away?
So I immediately asked so there's a team that comes in with everybody, and we have pastoral care. We have pastoral care residency program. So they typically try to figure out where the family is. So I turned and I asked where the family was, and they brought me to where Mr. McGrath was. And
do you have a recollection of telling the father that his son had passed away?
I do, very vividly.
And directing your attention, withdrawn. Dr. Conway, there was some indication that James McGrath had an elevated blood alcohol level that night. Anything about that fact that would have affected his injuries or the fact that he had died?
No.
Regarding the alcohol?
No.
Would you have treated him any differently if
we would have
he had
not.
Alcohol in his system?
We don't know that at the time, as I stated earlier.
And would he have still succumbed to his injuries even if the alcohol was present?
For this particular injury, yes.
And is there anything, Dr. Conway, that you vividly remember when you took, withdrawn? Was James McGrath ever taken out of that bucket stretcher and put somewhere else at some point?
Yes. So before I went out to go find Mr. McGrath, what we typically do to try to help the family see their loved one for the last time is the whole team, particularly the nurses, will clean up. It's a little messy after we've been working on somebody particularly that had bled significantly. So what we had done is all hands on deck because it was a big bucket stretcher, which is much heavier than it. And when we went to basically pull him, the bucket stretcher, onto a clean stretcher, there was so like liters and liters of blood that spilled all over the floor in the trauma bay, all over. It was in the bottom of that bucket. So we had to clean that up again. So that, which is consistent with the type of injury that he had.
Do you have a memory of that?
I do, because I did not want to go get his dad before we cleaned all of that up.
Final question, Dr. Crombie, from your expertise with an injury to the heart, such as the one that James McGrath suffered, what were the chances that he would ever survive such an injury?
Impossible, unless it happened in the hospital and we were right there to crack his chest.
Thank you. I have no further questions.
Tracy?
Would you like me to begin, Your Honor, or would you like?
Do you have an estimate on how long the class will be?
I think if Your Honor is okay with going perhaps a little past 3:30, that we should be able to complete the cross-examination.
All right, why don't we keep going then? Thank you.
Good afternoon, Dr. Crombie.
Good afternoon.
We've never met before.
We have not.
We've never discussed this case before.
We have not.
You are here to tell us today about the things that you did after the events that led to these injuries, correct?
That's correct.
And you were telling us that as part of what you did, that some blood was drawn from Mr. Connery, correct?
Correct.
You didn't know that at the time, but you told us that his blood alcohol level was a 0.125, correct?
That's correct.
And you said that 0.8 is considered impaired, correct?
Correct.
And 0.8 is considered impaired as far as for legal purposes for driving or for medical purposes or both?
Well, it could be a little bit of both. And I believe it's 0.08 when we do the conversion over.
Okay. So a 0.08 is too impaired to drive under the law, correct?
Correct.
And is also medically, is that a different sort of level of impairment than what we
It is.
use?
It
Okay.
is. So I guess I should explain that to you. So just like I was saying, like depending on your body mass index, depending on your age, depending on there is a enzyme in our livers called alcohol dehydrogenase, which breaks down the alcohol into the different components. And then the free components are what make us impaired. And depending on how fast those enzymes work, and then the size of our bodies has to do with the depot, and then our bodies, processing through that. The enzymes itself can be affected by multiple different factors, including any meds that you're on. Even if you were to take a Tylenol because you had a sore knee and you were 21 years old, it's going to be a little bit delayed in the metabolism or breakdown of that and clearance of that. In individuals that have a history of utilizing alcohol regularly, they tend to have more of this enzyme around and can clear it quite quickly. So they can seem very functional despite the fact that the legal limit or what's measured is, significant. There are various tables on this, but there's various different things that affect that. But, when this all evolved years ago, legally driving and operating motor vehicles was the 80 deciliters or the 0.08.
And in fact, it used to be higher than that, correct?
That's correct.
0.10. And it's been lowered as we've developed more information about the impairment effects of the alcohol, correct?
That's correct.
And when we have a BAC, that number reflects the amount of alcohol that's already been metabolized and is in the bloodstream at that point, correct?
That's correct.
And there's a fairly standard sort of metabolism rate for most people. Is that fair to say?
In general, yes. But just like I was saying with all of those different factors, and it's kind of like dive tables. They create them based on a bunch of different data and they come up with the metabolism. It's certain, in an hour it should be this, and an hour it should be this, and another hour it should be this.
Have you heard that for a male, about 2 drinks per hour would get you to a 0.08?
It's, again, there's some, I have heard that. I don't know if I necessarily think that that's totally accurate, because when you say male, it could be a 5'2" male, it could be a 6'7" male. And it could be something that one guy's never had a drink in his life. This guy drinks regularly, so it's completely different.
Age can affect that as well?
Age can affect it, yes.
And you mentioned a dive table. What's a dive table?
For those individuals that do scuba diving, the Navy tested exactly almost similar to alcohol, the amount of nitrogen that is in your blood that precipitates out if you dive a certain depth. And they tested it on various naval individuals, and then very similar to the alcohol tables, they have a level of clearance per hour, depending on the depth and the time that you were exposed to the oxygen.
Okay. And you told us that a 0.125 would indicate significant impairment, correct?
Well, I wouldn't say it's significant, but it is impaired again.
Okay. So you don't recall telling us that that would be significantly impaired?
No, significant is 500, 600, which I have seen. That's significant.
500 or 600, that would be close to fatal, would it not?
Depends on the individual again.
A 0.50, half of their blood being alcohol, and that would not be fatal?
So it's not a half. So you think 0.5 is 50% of your blood volume. It's actually a measurement of the ethanol or whatever is in your system. So they measure it on an assay, and they actually, it doesn't mean 50% of your blood. Okay. It's an assay.
And at a 0.125, you said that may have some effect on his injuries as far as bleeding or things of that nature?
It has an effect, exactly what I was explaining before, is that it's a diuretic. So what that means is that he's legally drunk. Level of impairment, as we've just discussed, depends on the individual. But what doesn't depend on the individual is that alcohol signals you to pee out and override your kidney's regular homeostasis. So how that can affect your injuries is that if you're already dry to begin with, you have a certain blood alcohol level that your body's trying to clear. I'm assuming they aren't drinking water in between the alcohol that they're drinking. He's bleeding. And then in addition to that, his kidneys are peeing out, taking some of the intravascular volume out of his body. So that can affect your injuries.
Okay. At 0.125, would you also expect that to affect his ability to accurately describe how he'd come by these injuries?
Again, it depends. When I examined him, he was telling me exactly what was described to him.
Could it affect his perception at that level?
It's hard to say. Again, it just depends.
Depends on the person.
It depends on the person. It's very different.
Would you expect somebody who had only had 2 beers a few hours beforehand to have a 0.125?
It depends. It has to go back to that alcohol dehydrogenase enzyme that I'm talking about, how active it is or how inactive it is. And then some of it is also just genetically, some people have more active alcohol dehydrogenase than others.
So you're saying that you would expect somebody who'd had 2 beers a few hours before you saw them to still have a 0.125?
It can happen.
Careful
Just
answers.
2 beers to get us to 0.125?
Depends on the individual.
Even if it was a number of hours beforehand?
It depends.
But they were,
how do you know it was 2 hours before?
They were Bud Lights.
If that's what the person said.
They were Bud Lights.
It's hard to say.
It is hard to say, isn't it?
Does it make a
It
difference?
would be
if it was a Bud
unusual.
Light?
Would you agree with that?
I wouldn't say it's unusual, but it's possible.
And we also talked about a 0.20 blood alcohol content level. You recall that?
I do.
That is more than twice the legal level of impairment of 0.08, correct? And would you consider that to be a significant level of impairment?
It depends on the individual. So if it's a 6'8" football player, maybe not.
When you say if it was a 6'8" football player, why would a 0.20 not be significant impairment?
So again, the way that the law, and I didn't make the law, deemed it is they took an average of individuals' impairments and they measured what their deciliter was. They did a bunch of tests and they said, do this cognitively, move this way. And that's how they came out with a 0.8. And that's now in a larger, more massed individual with a bigger liver, they can metabolize just better. is a line. And if it happens to be an individual that, has a history or has that genetic predisposition, each one of us is different. We're a mosaic of all of our genes. It depends on what their level of impairment is.
But you would agree that the law has said that 0.08 is
to operate a motor vehicle or motor, yes.
Or both.
Or both.
Heavy machinery.
Correct.
Is it irrelevant? Who said that?
And so if this jury was interested in why Mr. Valle did what he did that night, that's not anything that you could help them learn about, is it?
So I am here to describe the two patients that I took care of. I don't actually know who Mr. Valle is, I'll be honest with you.
Okay.
But I'm here to talk to you about the injuries that we treated that night and how we intended to save one of the victims.
Thank you.
You're welcome.
No further questions.
Any redirect? No redirect. All right. Thank you, doctor. You were dazed. Thank you.
All right, that
Just watch
brings
yourself
us to
as
the
you
end of the
exit
day.
space.
I think
Thank you.
we're live, so let's see if the judge changes her mind. But it's 3:30. Let me take a break now. Who is saying this? Somebody's whispering into the
Question
mic.
to the state, if I could inquire, was that the last witness that the state had lined up for today, or do we have another witness to call?
I believe we actually have another witness if you want to start the witness.
All right, why don't we do our 15-minute recess then, and then we'll get started on that. All right, court's going to stand
the
in
end
the
of the day.
afternoon, 15-minute recess. Thank you.
Okay, 15-minute recess. On this one, we have to sit out quietly. We've got to. I can't zoom anymore. We are stuck. We cannot turn the hands of time forward at all. It's some tough testimony to listen to. Oh my goodness! Hearing the efforts that went on to save this young man, and there was nothing they could do. It was just one of those injuries that was perfectly effective in preventing his life being saved, which is, a quarter inch one direction or the other could have changed anything, but it's sad. Very sad. What do we have here? What have we learned? I have to admit that medical witness, I really enjoyed listening to her. She was really good. But she also, hang on, I'm going to try to get this brought up here. Amber, hang on. Wait, don't say anything. Wait, Amber, wait. She also seemed to be defensive, and I was surprised that she said 2 beers 2 hours before 0.125. Yeah, that works. That checks out. That was a bit much. Amber, still wait. I'm still trying to connect Bluetooth. It's tough to do this. It's a tough job I've got here. There it is. Connected. Amber, can you hear me now?
I could always hear you, but can you hear me?
Yes. I just had to. I'm missing the plug. There's a little plug right here.
See that.
That's upstairs in my room somewhere. I've got 2 of them.
Well, I guess you need a third one, don't you?
Well, I had 3. I've lost 1. I usually keep.
Well, then I guess you need a fourth. You need to put an air tag on this cord.
It's this exact plug. It's this big, but instead of having a lightning adapter on one side, maybe I'll show you this way. Instead of having a lightning adapter on one side, it needs to be USB-C. So.
Right. Yep.
This one's garbage. You can have this one if you want. You don't want it either. Happy birthday,
So
Amber. How are you doing?
Well, thank you. I'm doing okay. I'll just leave it at that for now. I kind of wanted to touch on some of this testimony from this doctor. I think she's great. And I had a couple people ask me a few questions about how valid this testimony is as far as being medically inclined and those who are not necessarily medically inclined. Because when you think of a blood alcohol content, like she said, a 0.5 is not half the blood volume. But if you think of, in terms of, granted, Scott, I know you've never drank or don't drink. I don't know if never was.
Yeah, never's not the right word to use there. Let's just say I've been sober for most of my life, but there have been a couple times where, against my knowledge, I I was given beverages, which contained more than fruit punch.
Well,
have you ever felt somebody twist the sidewalk underneath you while you're walking? It is the most bizarre feeling.
Actually, that happened to me when
that happened to me too.
It is. It happened to me in a hospital bed when I was admitted for 2 weeks.
Once it was a friend who did it and thought it was really funny, and once it was a restaurant when I ordered the sober version, the virgin version, and they
right,
went,
and they forgot that part.
Oops.
They gave you the full Monty.
Yes, I got the, so to speak, in terms. Yeah, crazy.
Whew. So when you think of blood alcohol content in this testimony, don't try to compare it to other people you know who have drank. Compare it to yourself. When you've had a routine of having a glass of wine after work, or having a few drinks on the weekend, or having a glass of wine every day, whatever your routine is, when you take that routine away abruptly or not, but when you take that routine away for a certain amount of time, your tolerance, quote unquote, goes down. That tolerance is not actually a quote unquote tolerance. It's actually how fast your liver metabolizes that enzyme for the alcohol to process through the system. So when you think of this in terms of what your BAC or how she's explaining this, think of it in terms of what your tolerance is when you have a routine that you have a consistent vodka Sprite, you have a Diet Coke and rum, whatever it is. I don't care. It could be root beer for all I care. Sarsaparilla even. When you think of this type of testimony, think of it in terms of that tolerance level of yourself, because you know how you feel after you've had just one drink after having nothing for a year and a half. The tolerance is very different.
I'm sitting here listening to you and thinking of my 3 experiences with alcohol, one of which was my own fault. I was not feeling well at all, and for the first time in my life as an adult, I experienced the joy of NyQuil, which does in fact help you sleep beautifully. But 4 hours later, I woke up and drove to work, and people were so rude that morning. They were honking. They were flipping me off. It was I was so frustrated with people, how they were treating me on the road. I completely missed my exit to get to work.
I think that would have been operator error.
And it was only after I missed my exit and couldn't remember missing my exit that I realized that I might not be in the right shape to drive. I'd never experienced this before in my life. I had no idea. Honestly, I didn't know NyQuil had alcohol in it. I never read the little instructions.
Yeah, but kids these days, they're the reason we can't have things over the counter anymore.
I thought 4 hours later, I woke up and the alarm went off. I was feeling great. I was feeling better. I'm like, it's a miracle drug. No. I'm not bragging about that. I feel terrible about it. I never should have done that, but I honestly did not know. I had no clue. I can't tell you what state it in. What if there's not a statute of limitations to play? It's like, we're going to play this video for you. Exhibit A.
Quit talking now.
I think I was just tired. I was just really tired. But anyway,
now, being excessively tired can do the same thing. It's crazy how...
That may have been what it was.
It could have been. It's a possibility. So there's reasonable doubt. So you should be good.
Yeah. This testimony, this is an amazing doctor. I love listening to her. She seems a bit defensive. I wonder if we had someone who's more an expert with alcohol and its effect on the body. I realize she knows more than I do, right? But I'm wondering if there's a specialist that would come in that would answer the same way she did. She seemed to be sort of protective of her patient, saying this could be normal for 2 beers. And then when she asked, well, how do you know it was 2 hours after that? I think she was thinking about the one that passed away. as opposed to the one that got stabbed. I don't know. I don't know. I'm not sure. Did they take Jimmy's? Was his blood 1.125? Or was that
That I don't know.
I was not listening.
I don't know the specifics of whose BACs came back as what. But also take into account, some of them were drinking seltzers, which...
The girls apparently.
Funny.
It's the girls' drink, says the host. All the guys
Go
drinking
grab a
buds, and
beer.
the girls were drinking seltzers, and then one guy gets up there. I was just drinking seltzers. So
it also depends. So with different beers, you can have a different alcohol by volume percentage.
Right.
So with some of the more stout beers, they're going to be a higher alcohol by volume content, 12%, 15%, some even 20%.
Some fun fact: some beverages that you know and love in your state, in another state, are sold with a different alcohol percentage in it.
Very true.
Because each state has different requirements, and so there's one state that I lived in where people would always joke that if you drank a certain beverage, you were more likely to drown than get drunk because of how little alcohol was in it. But
the different terms and phrases that we use are not channel friendly, so I can't really say those.
It's all good. It's all good.
There are certain nicknames that make sense for why they have these nicknames, and y'all will get it once you figure them out.
Yep.
But you've got to consider that too. The alcohol by volume content. Granted, the darker the beer, usually the stronger.
Mm-hmm.
Or the darker the drink, usually the stronger, just for anybody who doesn't know.
But that's reverse.
The body weight.
That's reverse for like Coke. Like Coke is dark and Diet Coke is light.
It doesn't apply the other way.
There's no alcohol in that one. Okay, never mind. Forget I said anything.
No, you got to put it in those.
It doesn't work that way. No.
Right. So
this is what I'll learn. I think. Although we're focusing a lot on it, the alcohol was a factor in decision making. Okay, it might have given them a little more willingness to be like, hey, let's do this type thing, right? We're not talking about somebody who was so completely drunk that they fell over and hit their head and passed away, or couldn't see straight and thus was couldn't hold their own in a fight or something like that. It was just. It's young, dumb kids with alcohol and making poor decisions. Lowered ambitions. But.
I would agree. Granted, this also I'm trying to spell exemption while I'm talking, and I want to start typing what I was saying. Anyway, yes, Karen, Guinness is generally an exception to almost every rule. Alcohol wasn't necessarily the causative factor, but considering the age, now did I drink before I was 21? I worked in a bar before I was 16, so I'll let you answer that question.
How did you swing that? Don't they check their employee IDs too?
Oh, sure, but I was paid under the table and wasn't officially on the books.
I guess under the table is better than on the table in this case, so you're probably good.
I've never looked my age, and I'm hoping as I get older that it reverses and people think I look younger now.
Yeah.
I'm kind of hoping, because everybody always thought I was way older. Yeah. Anyway.
Wait. I have to take back what I said. I don't think alcohol was the cause of the fight, but it was actually the cause of the first fight. They were fighting over the beer. And who got to keep it? But it hadn't been drunk yet at that time.
I mean, there were a lot of adult decisions made with a lot of juvenile brains and lack of supervision. Yeah. Look, I have 4 boys. My oldest is 25 and my youngest is almost 5. So, I mean, I've seen just about everything I think there is to see. And did I grow up with the rule of I'd rather you try it at home than try it somewhere else and something happened to you? yes, but no.
I've heard that argument. Make your mistakes, learn here at home, safe environment.
Right. And it wasn't necessarily to make it a habit. It was to understand what the effects are on you and why you can't make those decisions when you're incapacitated with alcohol at that age. It's very, very different, especially with the body chemistry, the athleticism, especially in these kids. Most of them were playing 2 sports, if not just one.
They had practice the next day.
So
they're all on the same team. One of them's like, I couldn't drink much because I had practice the next day.
How much water did they drink? I mean, how much water do they usually drink?
All the beer pong
Are they
cups.
usually pretty high?
I had 2 beers.
If you didn't know to put water in your beer pong cups.
They're back.
Good afternoon.
Amber, I gotta let you go.
Good afternoon.
Happy birthday.
Okay, bye.
We'll see.
You may be seated. Thank you. Counsel, are we prepared to call the next witness?
We are, Your Honor.
All right, we'll bring the jury in then.
Okay,
Thank
I
you.
said this is the end of the day. This is the last witness of the day, apparently. 3:30. We're probably going till 4. Well, I don't know. Maybe we'll go to 6. I don't know because we're live. They've usually been like.
Counsel, I would plan to stop at 1:15.
That's fine, Your Honor.
There we go. There's our answer.
Yes, I could probably take us till 4:00.
Okay.
Don't drink the water in the beer pong cups. You take drinks of your beer. Oh, okay. Never figured that game out.
Thank you. Welcome back, ladies and gentlemen of the jury. Counsel, please stipulate to the return of all of our jurors.
State will stipulate, Your Honor.
Defense stipulates, Your Honor.
All right, very good. So the state at this time, if you would like to please call your next witness.
Thank you, Your Honor. State would call Ryan Hines to the stand.
Thank you.
Ryan Hines. We've heard his name many times. He appears in the screenshots. He appears in the videos. Right up close. Possibly even involved in the altercation. One of the individuals who I believe was in the group that was in the house that came out, right?
Good afternoon. Please step up into the witness box and remain standing. Madam Clerk is going to put you under oath. Thank you.
Please raise your right hand. Do you solemnly swear or solemnly and sincerely affirm, as the case may be, that the evidence you shall give concerning this case shall be the truth, the whole truth, and nothing but the truth, so help you God, or compound to your perjury?
Yes.
Thank you. Please state your full name, spell and your last name.
Ryan Hines, RyanHeinz.
You can please state your address.
91.
Don't need his address.
Thank you. You may be seated. You may proceed.
Thank you. Ryan, do me a favor. Just sit close to that microphone and keep your voice up because the acoustics in this room is not too good. Thank you. Good afternoon.
Yes, it is 20 as well.
Can you please tell the ladies and gentlemen of the jury how old you are?
I'm 19 years old.
And do you go to school?
Yeah, I'm going to be attending Alfred State University in the fall.
And what are you going to study?
Heavy machinery operations.
And prior to Alfred State University, were you in school?
I just ended a postgraduate year at Bridgeton Academy.
And did you play any sports?
Yeah, I played football there.
And are you working for the summer?
Yes, I am.
What are you doing?
I'm working at the UPS store in Fairfield.
Now, prior to your testimony today, have you and I met?
Yes, we have.
About how many times?
3, 4.
And why did we meet?
To talk about today.
And I want to direct your attention to May 14th of 2022. How old were you back then?
I was 16 years old.
And did you go to school?
Yes, I did.
Where did you go to school?
I was in Sheldon High School.
And did you play any sports?
Yeah, I played football and baseball.
And what year in school were you back then?
I was a sophomore at the time.
You were a rising sophomore, or were you ending your sophomore?
I was ending my sophomore year.
So I want to direct your attention to earlier on in the day on May 14th of 2022. You familiar with Griffin Marcinzik?
Yes, I am.
How do you know Griffin?
Griffin's a really good friend of mine. Ever since I moved to Shelton, he's been one of my first buddies.
And did you and Griffin hang out somewhere earlier in the day on May 14th of 2022?
Yeah, I think we hung out at his house for a little bit that day.
Around what time would you say you were at his house?
Getting closer to the evening time.
And at some point, did you leave his house?
Yes, I did.
And where did you guys go?
Natalia Ridzik's house.
And how did you get to Natalia Ridzik's house?
I believe we walked.
Is it close?
Yeah, it's only 2-3 streets away.
And when you got to Natalia Ridzik's house, what kind of things were you guys doing there?
Just sat down, hanging out. She had a couple people over. It was no more than like eight of us there.
Now, were you guys drinking alcohol?
Yes, we were.
And were you drinking?
Yes, I was.
And how much were you drinking?
I would say at her house, no more than 2 beers.
Did you drink at Griffin's house prior to going to Natalia's house?
No, I didn't.
When you went to Natalia's house, did you bring any alcohol with you?
Yes, I did.
And what did you have with you?
I had a 12-pack of Bud Light with me.
And you said you drank 2 beers out of that Bud Light?
Yeah.
Okay. And how long would you say you were at Natalia Ridzik's house for?
30, 40 minutes, something like that.
And at some point in time, did you and Griffin leave Natalia's house?
Yes, we did.
Why did you leave Natalia's house?
Because we were invited to Austin Leifer's house.
And do you know where Austin Leifer's house is?
Yes, it's on Lazy Brook.
And did you in fact go to Lazy Brook Road?
Yes, we did.
And how did you get there?
Tanner Chernowski drove us there.
Okay. And when Tanner Chernowski drove you there, was it just you and Griffin?
Yeah.
And at some point in time, did he drop you off?
Tanner, yeah, he dropped us off.
Lazy Brook Road. Around what time do you think he dropped you off?
Gosh. Around like 7, 8 o'clock, somewhere around there.
And around 7, 8 o'clock, what was the lighting out like out?
It was still daylight out.
And at some point in time, was it getting dark?
Yeah.
And when you got to Lazy Brook Road, can you tell the ladies and gentlemen of the jury what happened when you got there?
So we showed up there. We were just walking up the driveway, and then the garage door was open, and we just heard music and noise, and we walked into the garage, and that's about as far as we got in.
Now, when you got to Lazy Brook Road, were you drinking a beer down the driveway?
No, I still was only at 2 beers.
And you say you got as far as the garage. Why did you only get as far as the garage?
Because as we're about to walk into like what you would like the door from the garage, like into the house, there's 3 or 4 people getting kicked out, it seemed like, of that door and getting told to leave.
And do you know who those people were?
At the time, no.
Do you know who they are now?
Yes, I do.
And who are they?
The defendant, Jack Snyder, and Tyler De Silva.
And you say the defendant. Who is the defendant?
Raul Valle.
And is Raul Valle in the courtroom today?
Yes, he is.
And what is he wearing?
Black suit.
And can you please point him out for the...
He's right there.
Your Honor, may the record reflect that the witness has identified the defendant in this case?
Court will allow the record to reflect that the witness has identified Mr. Valle.
Now, when you say you were trying to get into the house and the defendant and his friends were being what you deemed being kicked out of the party, tell me what happened at that time.
Him and his friends started just questioning us who we were and asking what our business was there.
And what was your response to that?
Austin had invited us over. I played football with Austin for a year in 8th grade for Shelton. Became pretty good friends with him. And he had told me and Griffin that night, come over, I'm having a party, come over.
When you got to Lazy Brook, did you notice if there was any drinking going on at that house?
Oh, yes, there was.
And when you responded to the defendant and his friends, telling them that you were there because you were invited by Austin, what was their reaction to that?
They didn't care. They didn't seem to ask Austin who we were. They didn't care. They weren't worried about if we were invited or not. They weren't worried about that.
Was the defendant saying anything to you in particular during those moments?
No, not really. It was more of Snyder that was saying stuff to me.
And at some point in time, how long would you think that interaction between you and the defendant and his friends lasted for?
About 2 or 3 minutes.
And then at some point in time, withdrawn, did this interaction happen inside the garage
all
area?
In the garage, all in the garage.
At some point in time, did the interaction between you and the defendant and his friends extend to outside the garage?
Yes, it did.
Tell us about how that happened.
So basically, it started with Snyder asking me for a beer because I had my 12-pack in my hands. And I actually said, yeah, sure, you can have a beer. And then the defendant asked me for a beer also. I said, yeah, sure, you can have a beer. I gave each of them a beer. And they were just like, they weren't okay with that. They started getting very argumentative with us, still wanting to know who we were, why we're there, and insisting that I give up my whole entire pack of beers for them.
And what happened after they insisted that you give up your beers?
Like I said, I gave each of them one beer. I was just like, is that all right? Like, can we just be cool about this? And for a second, it seemed like, yeah. They were like, yeah, sure, it's cool, it's fine. And we're like, all right, cool. Like, can we get by? And then all of a sudden, I get my beer grabbed from out of my hands by Snyder. And then all of a sudden, me and Griffin are getting pushed out, not on our own.
And how are you getting pushed out?
Literally got grabbed and just started being walked out by Snyder out of the garage into the driveway.
And once you got out into the driveway, what was your reaction to how you were being treated?
I was in shock. Like I wasn't trying to be an aggressor in any sort of way. I just had given them a beer, trying to be cool, make some friends, whatever. But they were very just like, fuck you, blah, blah, blah. Who are you? All this, that, and another thing.
And at some point in time, did you get angry with him?
Yes, I did. I got upset with Snyder, and I simply said to him, listen, like, that's not how this is going to happen. And I told him, like, I'll fight you for my beer right now.
And so when you told him you would fight for your beer, what did you do?
That was a good idea.
He said, okay, sure. I don't know where or who had my beer at that point in time. And I kind of just put my hands up, getting ready to fight him.
Now, prior to you getting ready to fight Snyder, do you remember what he was wearing at that point in time?
He was wearing, I believe, some sort of Nike hoodie and some shorts.
Do you remember what the defendant was wearing?
Yeah, he had a Ole Miss baseball shirt on.
Show you State's Exhibit 53.
This is a crazy case.
Show you State's 53. Is this what you recall the defendant and Snyder looking like that night?
Yes.
Okay. You see that the defendant has some the helmet on?
Yeah,
he's holding a teddy bear too.
Usually talk
Whole time.
Okay. And he has some type of neck pillow on?
Yeah.
Did he have that on when you spoke to him in the garage?
I don't recall.
Okay. So when you get out into the driveway, you square it up with Jack. What does that mean, you square it up?
I put my fists up, like just kind of saying, all right, let's go. Let's do this.
And did Jack, in fact, put his hands up?
Yes, he did.
And at some point in time, what happened after that?
I'm kind of looking at Jack, just like kind of walking closer to him, like about to go and punch him. But then it happened so fast where I get hit, like right here, I get hit. And I'm thinking it's Jack that hit me. Like it happened so fast, but then I'm like, whoa, like he's far away. But it just instincts took over, and I just went and tackled Snyder to the ground.
And at some point in time, how long would you say the fight lasted for?
30 seconds.
And do you know who you were fighting with at that moment?
I was just trying to fight Snyder.
And do you know if anybody else was fighting with you?
I felt a lot of blows to the back of my head multiple times, over and over, repeated, getting like what felt like being punched in the back of my head many times while I was just on top of Snyder. And then all of a sudden I'm getting ripped off by my neck and that was about it.
Wasn't a fair fight.
I'm going to show you what's been marked as State's Exhibit 58. Like, have you seen the video from the fight at Lazy Brook?
Yes, I have.
That was the first fight where the girls are like, hey, knock it off. It doesn't impress us.
Stop right there. So I'm going to give a pointer right there.
Yeah.
So this is frame 47. The individual here in the red sweatshirt, do you know who that is?
That's Snyder.
Okay. And the guy here in the green sweatshirt and the black shorts?
That's me.
Do you know who this is behind you?
That's the defendant.
Okay. Just play a little bit. Right there. Frame 100. This individual right here to the left, do you know who that is?
That's De Silva.
Now, after this fight ended, what did you do?
I got my beer back and I left.
Do you know how you got your beer back?
I believe the lifer's mother gave it back to me.
And was there any arguing back and forth going on after this fight ended?
No.
You just grabbed your beer and you took off?
Yep.
Now, when this fight occurred, do you know whether or not, do you recall where Griffin was at the time?
He was like, I don't know.
You can't see him in the video.
No, he's not in the video. He's like over to the right more. Like,
but he
you kind of see where those people are standing behind it to the right.
Yep.
He's like a little bit more behind them and to the right. I don't know. Somebody like, I think somebody like grabbed him and like held him back, not letting him.
But in other words, he was close to see what was going on, right?
Yes, Griffin definitely saw.
Now, at some point in time, you grabbed your beer. What did you do? Walk up the driveway?
We'll walk down the driveway.
Walk down the driveway, excuse me. Okay, when you walked down the driveway, what did you do when you got to the end of the driveway?
Me and Griffin were kind of just standing there like, well, we got to leave, but we don't have a ride or anything like that. But then I can remember there were girls down at the bottom of the driveway and they offered to give us a ride home.
Showing your States 59. See that? Do you see States 59?
Yes, I do.
Who's this individual in the back here?
That's me.
That's you.
Yep.
Throwing up the
And
deuces.
was this picture taken before or after the fight?
Oh, that's after.
And can you see, if you look close enough, looks like you have a
cut lip.
Look like you have like a bloody lip there?
Yeah.
Who's this individual here to the left of you?
That's Griffin.
Okay. And did you know any of these girls that night when you walked down the driveway?
I did not know.
Did you give them beers?
Why were you involved in this picture?
I don't know.
Because somebody else took it?
Yeah.
Why are they all holding Bud Lights?
Did you get a ride home from Lazy Brook after this picture was taken?
Yes.
Who took it?
One of these girls.
Okay. And where did they take you?
Back to Natalia's house.
And when you were at Natalia's house, did you drink any alcohol there?
I don't know. I didn't.
How long would you say you were at Natalia's house after they gave you a ride there? How long were you there? 10 minutes? Now, at some point in time between Lazy Brook and Natalia's house, did you become aware of a group chat that had started?
Yes.
And tell us about that.
That was a group chat that I had been added to a week or two prior, actually.
Why were you added to it? Do you know why?
I really don't know, to be honest. My buddy Michael Kinnick added me to it. It was his little like basketball group chat to go play at the community center with some buddies. And I just remember that group chat. Like there would be a lot of shit talking that happened in that group chat, like all the time. And he just one day added me to it and was just like talk some shit to these kids, blah, blah, blah. That's really all I remember
So you
about
didn't actually go play basketball?
No, you could ask any of my friends. I don't really like playing basketball.
Now, do you know whether or not the group chat involved any of withdrawing? The individuals that you just got into an altercation with back at Lazy Brook, did they go to school with you?
Just Griffin.
Griffin went to school with you, but did the defendant go to school with you?
No.
Do you know where he went to school?
He went to St. Joe's.
What about Jack Snyder?
He went to St. Joe's as well.
What about Tyler DeSilva?
He went to St. Joe's.
Do you know if any of the girls in this picture here Stage 59, do you know if any of the girls in this picture, did you go to school with any of these girls?
No.
Do you know where they went to school?
I believe St. Joe's.
Okay. Now, in this group chat, were you aware as to whether or not individuals from St. Joe's were added to the group chat?
I was not aware. I saw a lot of phone numbers being added to it, but I didn't know who was who and all that.
Do you know whether or not what was said, but do you know whether or not any commentary that was going on in the group chat when you were driving from Lazy Brook to Laurel to Natalia's house had anything to do with what had just happened at Lazy Brook?
No.
Were you in fact involved in the group chat from Lazy Brook to Natalia's house?
Not that I recall, no.
Do you know whether or not Griffin was at that point?
Not that I recall.
So when you get to Natalia's house, you said you're there for 10 to 15 minutes?
Yeah.
And at some point in time, you leave Natalia's house?
Yes, I did.
Why?
Charlie came and picked us up.
Charlie who?
Connery.
And how do you know Charlie Connery?
Good friend of mine.
And did you go to high school with him?
Yes, I did.
Now, at some point in time, after you leave Lazy Brook, when you get to Natalia's house, do you text message anybody about what happened to you at Lazy Brook?
No, everybody already knew for some reason. I didn't go around telling people all this and that about what happened. I didn't really care that much. I didn't tell anybody about it. Everybody just already knew.
Well, in fact, at Lazy Brook, did you go there to fight?
No, I just came because Austin invited me.
Now, so Charlie Connery came and picked you up from Natalia's house. Where did he take you?
To the richest house.
And when you say the richest house, who's the richest?
Tyler Rich.
And how do you know Tyler Rich?
I just played football with him that past year.
Did you go to school with him?
Just for that sophomore year because due to COVID, freshman year, all that stuff. So freshman, sophomore year, you could say, yeah, I went to school with him.
States Exhibit 5, do you recognize this house?
Yes.
Whose house is that?
Tyler Rich's house.
Nick and friends, thank you for
And when you got to Tyler Rich's house, did you go in immediately inside the house?
Yes, I did.
And how many people would you say were there when you got there?
20 to 30.
And when you got there, what kind of things were going on inside the house?
I just had people coming up to me and questioning me what had happened, just wanted to know what had happened. I wasn't everybody like I said before, they already knew. I don't know how they knew, but they knew what had happened, and I just simply explained to the people that asked me what had happened.
Fought some dude for my beer.
And did you in fact tell them what happened at Lazy Brook?
Yes, I did.
Now, when you were, aside from what you told people happened at Lazy Brook, what other things were going on inside Tyler Rich's house?
Conversation.
People hanging out?
Yeah.
Were people drinking alcohol?
Yes.
Okay. Did you see who was drinking alcohol, or was it just kind of just there and people?
Yeah. It was just.
What kind of alcohol was being consumed? Do you remember?
Just beers or a seltzer or something like that.
Did you bring your beer or what was left of them with you to Tyler Rich's house?
Yes, I did.
Did you in fact drink any alcohol when you were at Tyler Rich's house?
One
beer?
Yeah.
Now, when you got to Tyler Rich's house, how did you enter the house? Do you remember?
Through the cellar side doors.
Do you recall where the cellar side doors are?
Yeah, it's on the right of the house.
It's a BYOB thing.
So I'm pointing to this area here. Is this around the area where you came into the house?
Yeah.
Okay, so it would be on the other side of this AC unit?
Yeah.
And when you got there, actually withdraw.
There's another withdrawal up to 64.
Showing you states 54. Do you know who that is?
It's Faison.
And how do you know Faison?
Just went to school with him and played a season of football with him.
Do you know whether or not Faison was at Tyler Rich's house when you got there?
I don't know.
But was he there at some point in the
Yes.
night? Showing you states 55. Do you know who that is?
Yeah.
Who is that?
That's Tommy Connery.
And how do you know Tommy?
He's Charlie's older brother.
And was he there when you got to Tyler Rich's house?
I believe so. I wasn't really looking around to see who was there, who wasn't there, but yeah, I believe.
You said there were 30 people there.
Yeah, he was there.
Did you take into account every single person that was at Tyler Rich's house that night? But you recall seeing Charlie there? I mean Tommy there?
Yeah.
Showing you states 57. You know who this is a picture of?
Yes.
Who is that?
That's Jimmy McGrath.
And how do you know Jimmy McGrath?
I'd met him one time previously at Tyler's house, I think a few months beforehand. That's really my only relation with Jimmy.
Do you recall seeing Jimmy at Tyler's house?
Yes, actually, I remember talking to him. Actually, he was one of the first people I did talk to when I got there. He was asking me what had happened that night.
Police for kids.
Exactly, yep.
Exhibit 56, who's that?
Me.
And do you know when this picture was taken?
In the hospital.
Now, are you familiar with Enrico Fiola?
Yes.
How do you know Ricky?
Very good friend of mine.
And did you go to school with him?
Yes, I did.
And how about Sal Perry? Do you know Sal
I know
Perry?
Sal, yeah.
And how do you know him?
Played football with him.
How about Mike Samperry?
Yes.
How do you know him?
Just friends. Just got to meet him when I first got to Shelton. We became good friends. He went to a different high school, but we still remained good friends.
How about Alex Bernston?
I'd met him like 2 or 3 times prior, just when I was with Tanner, hanging out with him. Alex would come around every now and then.
Okay. Now, the individuals I just mentioned, were they all at Tyler Rich's party? Do you remember seeing them?
Yes.
Okay. Now, after you got to Tyler Rich's house and you were telling people what had happened, did you guys kind of just hang out for a little bit?
Yeah.
Do you know whether or not this basketball group chat, was this going on at the time?
Yeah, I wasn't really too involved in it, but I was feeling the notifications going off in my pocket on my phone. My phone, I felt the buzz going off on my phone, and I knew there was stuff being said in there. I just don't know what was being said exactly.
Do you know who was saying
I can guess.
anything? You don't know? You just, did you glance at it and say, oh, that's
I would just look at it and be like, oh, whatever, put it back in my pocket.
Now, at some point in the night, did individuals show up to Tyler Rich's house that weren't invited?
Yes.
Okay, and how long would you say you were at Tyler Rich's house before that happened?
10, 15 minutes.
And how were you made aware that these individuals showed up to Tyler Rich's house?
Everybody was just like, they're here. They showed up, and people started walking outside.
Were you made aware of it through other individuals in the house, or were you also made aware of it through the group chat?
Just other individuals in the house.
And when you were made aware that they were here, what did you do as a result?
Walked outside.
And how did you walk outside?
Through the cellar doors that I came in from.
And when you walked outside, I'm going to show you this exhibit here. See, it's 49. When you walked outside, can you tell us, where did you walk from the house?
Through the side where the cellar doors are, and then kind of through the driveway, and then the car was parked roughly right in front of the driveway.
So if I correct, you walked this way, for all intents and purposes with this exhibit, there's a blue truck here.
Yeah.
You walked down the driveway, and you're saying the car was parked somewhere in front of the driveway?
Yeah, maybe a little bit farther back, but yeah, right about there.
Was it parked on the side of the road?
No, it was more like right in the middle of the road.
So was the car parked somewhere around here?
Yeah.
Okay, so if the record can reflect, the lower portion of this exhibit, just to the left of the trees on the right side of Laurel Glen Road, towards the middle of the road.
Noted for the record. Thank you.
And when you saw this this car on the road, what did you notice about it? What did you notice what type of car it was?
Yeah, it was SUV.
And showing you State's Exhibit 30, does that seem to be what you saw that night?
Yes.
And which way was it facing? Was it facing towards Adams or was it facing towards Farmhouse? The Exhibit 1's behind you if you want to.
It was facing towards Farmhouse.
Okay. You need to use this. And did you approach this vehicle?
Yes, I did.
And when you approached the vehicle, what side of the vehicle did you approach?
The driver's side.
And how far away did you get from the vehicle when you stopped, when you walked up to it? How far away?
I was right next to it.
And did you talk to anybody in the vehicle?
No.
Did you notice anybody in the vehicle?
Yes.
Who did you notice?
I noticed Snyder driving, and then I noticed De Silva, Raul, and Mackenzie Traficante.
Did you notice anybody else in the vehicle?
A few others, but I didn't know who they were.
They're the beer thieves.
And can you describe, did you have at some point in time withdrawn, how many of you approached the vehicle?
Maybe 15.
15.
15.
And when you approached the vehicle, did anybody have a conversation with anybody in that vehicle?
Yes.
What was the conversation like? Not what was said, but what was it like?
It was, I don't really know how to explain it. Like, I feel like there was multiple different conversations going on throughout the vehicle.
Imagine that's right.
Like, I feel like someone was having a conversation with the front passenger, someone was having a conversation with the driver, somebody was having a conversation with the people in the back seats. So I'm not really too sure what was said, but it was, the overall tone of it was totally like chill and like normal. And then there were parts of it that were aggressive. And
why did it get aggressive?
Because they had jumped me.
And did you say anything to anybody when you were there?
No, not that I recall.
Do you recall if the defendant said anything to anybody?
No.
I don't know if you call it being jumped
at some point in time, you said that it got aggressive?
Yeah.
And when it got aggressive, tell the ladies and gentlemen of the jury what happened when it was getting aggressive.
Cans started getting thrown at the car. And then the car started whipping up and down the road.
Now, when you say cans got thrown at the car, who threw cans?
Multiple different people.
Did you throw any cans?
Yes, I did.
And what kind of cans did you throw?
I threw my Bud Lights that I had still.
Were they empty cans or were they full cans?
They were full cans.
Okay. Do you recall where you threw the can?
I believe I was on the other side of the car at this point, so on the passenger side now. And I believe I hit the door, the passenger side door. And then the other can I threw completely missed the car because I believe the car was moving at the time.
So you see this defect in the windshield here?
Yeah.
Did you recall doing that yourself?
I did not do that, no.
So if that was done that night, that was done by somebody else?
Yeah.
If it was done that night?
Yeah.
Full cans. So he's drunk 3 beers now, and he's thrown 2. So he's
after the beer
5.
cans were being thrown, other things were being thrown at the car. Did anybody else put their hands on the car? Was there anybody else doing anything else to the car?
Not that I recall, no.
And you said the car at some point left?
Yeah.
And where did it go?
Just up and down the road.
When you say up and down the road, if you're looking at State's Exhibit 1.
It was just going back and forth like this way.
And when it was going back and forth, what, if anything, was the car doing?
Going really fast.
Were they throwing anything from the car?
No.
You don't remember any of that?
No.
Where were you when the car was going up and down the road?
In the driveway.
And were you paying attention to it the whole time, or were you talking to other people?
Yeah, a mix. Like I would pay attention to it, then I'd talk to the person next to me, something like that.
Now, when you were initially at the car, do you recall who was with you out of all your friends?
No, I wasn't worried about any of that.
Why can't you recall who was with you at the time?
I just wasn't looking for who was with me. I just knew it was my friends, people that I knew weren't going to do anything to me.
Do you know if Tyler Rich was there?
No.
Do you know if Griffin Marcinzik was there?
No.
Do you know if Ricky Fiola was there?
No.
Now, when the car went up and down the road and you were in the driveway, you said?
Yeah.
You said you were just talking to your friends, kind of paying attention. Were you kind of looking down the road? Yeah. What were you doing? Okay. And you said you were talking to your friends. What friends were you talking to? You remember?
No.
Why can't you remember?
Just normal conversation. Just can't remember.
Can't remember the particular person we're talking to. At some point in time, did the car stop driving up and down the road?
Yes.
And where did you see it stop?
Like right at the corner of Farmhouse and Laurel Glen.
And when it stopped at that corner, what, if anything, do you remember happening next?
I can remember Tyler Rich running down there after the car, and I actually I didn't go fully down there, but I also kind of like walked about halfway down the road towards it.
So I'm showing you this exhibit here.
Yeah.
This is State's Exhibit 49. Can you show me on State's Exhibit 49 where you walked down to?
To about like where all the trees are. I just remember the trees on my side.
The trees here?
The other side of the road.
These trees?
Yeah.
So just past Tyler Rich's property on the left-hand side where there's these, looks like pine trees?
Yeah.
You stopped right around here?
Yep.
So if the record can reflect, he's on the left side of the road, just past the 43 Laurel Glen property, next to what appear to be pine trees.
He's seen the ring video.
Record shall reflect it. Thank you.
And when you were there, how far away were you, do you think, from where the car was?
I don't know. Several feet away from the car.
Like hundreds of feet, maybe 100 feet, a couple hundred feet?
I don't know.
Were you close enough to see anything going on down the road?
Not really. I was just able to like make out like people and that there were people down there.
And what did you see?
Just like people talking, it looked like, really. That's
and
about it.
When people were outside the car or inside the car?
Both.
And when people were down there talking, do you recall if any of your friends were down there at the same time?
Yeah, I know Tyler Rich was down there.
Did you know if anybody else went down there? No. Did more than just Tyler Rich go down there, though?
Yes.
And do you recall whether or not, outside of talking, did you see anybody get into any physical altercation or fight down there?
No.
Did you see anybody throw anything down there? How long would you say that you were watching what was going on down the road at that point in time?
I think I watched for like 30 seconds and I just stopped caring and I walked back to the house.
You walked back to the house. Did you go back inside the house?
Yeah.
So tell us how did you get back inside the house?
Same way that I went in previously through the cellar doors.
So did you walk down the road, cut across the property and back into
I cut through the yard and went through the cellar doors.
And when you got back inside Tyler Rich's house, what did you do when you got back inside the basement?
I just like kind of stood there for like a minute or two. Everybody seemed to be in there. And then all of a sudden I just hear, they're back. They're back. They're in the yard.
Now, before you heard they're back, what kind of things were you guys doing? Were people still drinking, having a good time, hanging out?
Not really anymore. Everybody's kind of just like, this night's over.
Killed the vibe.
Nothing good about it.
What time of day was it? Was it late?
I don't know. Like,
if you can't recall, you can't recall.
I can't really recall.
It wasn't light out though, right?
No.
And was it, when you were outside, was it dark enough that you couldn't see in front of you?
No, it was a nice night. Like, it wasn't dark. Like, it wasn't pitch black outside. Like, you could see the person in front of you. You could see like somebody 10 feet away from you. You can make them out.
Were there any other lights around the area at the time? Do you remember if there were any lights from the house?
There was like a sensor light from the house, but that's really all I recall.
And you said at some point in time, you heard somebody say they're back.
Yeah.
When you heard somebody say they're back, what did that mean to you?
I don't really know what it meant to me. I just instantly was like, I want to go see what it is.
So you were curious?
Yes.
And because you wanted to go see what it was, what did you do as a result?
I immediately went right back out the cellar door and walked into the yard.
And when you walked into the yard, showing you State's Exhibit 5, where did you go? Do you recall where you went? Can you show me in State's Exhibit 5?
I'm somewhere behind like this red bush.
Okay. So you're somewhere over here?
Yeah.
So the record can reflect I'm pointing to the left side.
That bush
just
gets taken
behind
out. Everyone's
red
lost.
bush.
Record can reflect. Thank you.
And when you come outside and you're near this bush here, what do you see when you come outside?
I see the defendant, and then I see De Silva.
And can you tell us on State's Exhibit 5 where you saw them?
About the same area. De Silva was, like, if I'm looking at them, De Silva was behind the defendant to his right a little bit, maybe 3 or 4 feet.
So if you're looking this way,
Yeah.
De Silva's over here.
Yeah.
Okay, and the defendant is where?
Right in front of me.
And tell us about your did you have an interaction with these two?
Yes.
Just tell us about that.
So when I walk outside, the defendant had just like put his shirt up over his head. And like, I can't do it right now, but he like put his shirt over his head and was just like quietly, very calmly saying, "Where's Ayden King? Where's Ayden King? I want to see Ayden King." And just kept repeating that over and over again.
Did you ask him why he wanted to see Ayden King?
I wasn't really worried about it. I didn't care.
Style.
And what was your reaction when he was asking about where Ayden King was?
I just was like, "Don't worry about it. I'm right here. What's your problem? Like, why are you back here?"
Yeah. And what was his response?
"Where's Ayden King?" And then I caught, like, I was like, "Why do you have your shirt on your head like that?" I was saying that. And then I pulled the shirt off of his head, not like hard or anything like that, but I just grabbed it, I pulled it off of his head. And then all of a sudden, like that, it was just a totally different person. And it just got crazy.
What do you mean?
Like, the defendant was really calm and just quiet and was just like, "Where's Ayden King? Where's Ayden King? Where's Ayden King?" And I'm, like I said, I don't know. I don't care. Like, I'm right here. What's the problem here? Pulling the shirt off of his head. And then the second I pulled the shirt off of his head, just starts freaking out, like get very upset and argumentative, and forgot about Ayden King and did worry only about me and the people next to me.
And when you say argumentative, what was he doing?
Just like getting real fast and just like, "Oh, like, you took my shirt off my head. Like there's going to be a problem now, blah, blah, blah." Like, just all types of stuff like that.
Do you recall when you were talking to the defendant in the yard, do you recall who was near you at the time?
Yeah, Nikki DeJesus and Tywood right next to me.
And do you recall, if you can, was there anybody near Tyler De Silva?
Oh, no, I wasn't worried or paying attention to Tyler De Silva at that point in time.
And when the defendant started to react the way he did and get crazy, as you said, what happened? What if anything happened next?
Me, Nikki, and Ty immediately were just like, we're from me to the microphone at this point now, away from him, just looking him right in the eyes, and we're just chirping each other back and forth.
And when you say chirping each other, what does that mean?
Talking shit.
Okay. And how long did that last for?
Until we ran out of things to say.
30 seconds, 45 seconds.
At any point during your chirping back and forth, did you ever tell the defendant to leave?
No.
So after about 30 or 40 seconds, what happens next?
Out of nowhere, really, Tyler Rich punched him in the face.
Do you know why he punched him in the face?
He was on his property. I'm not really sure other than that, though.
But how did you see Tyler Rich punch him in the face?
I just saw like his fist and just hit him in the face.
Come over across. Where was Tyler?
I don't know where Tyler was. I just literally I was looking the defendant right in his eyes, like right in his face. Like that's all I was looking at. I was locked in on that, and Tyler Rich's fist just punches him.
How do you know it was Tyler's fist?
I figured that out after the fact.
So you didn't know it at the time?
No, at the time.
But it was one of your friends that punched the defendant in the face?
Yes.
And when that happened, what happened after that?
I kind of, it's like weird from there. Like I just kind of go at the defendant and I punch him in the face like 2 times.
And when you did that, did the defendant engage you?
Yes, he did.
And can you tell us a little bit about how
he was stumped, when he got punched in the face, he stumbled back and just kind of fell. And then that's where I kind of got over him and I punched him in the face. And then all of a sudden I just feel like a like a weird sharp pain in my side. And I just kind of went like this, and I went like this, and I looked down to this, and I see him with his fist clenched up like this, and kind of like his shoulder and like bicep area right here were like held back by something, but he was going like this. And I'm you can say I was like on top of him at this point, but he's going like this. And I just see like a jabbing motion towards my side. And that's where I felt like the stick right prior. And then all of a sudden I'm just like, I gotta get away. Like I gotta get out of here. And I get off and I just walk away.
And how many times would you say the defendant hit you?
Oh,
do you recall?
I mean, I got stabbed 3 times, but I don't know. He was just going and going. Like it was not like he wasn't trying to hit me in a certain spot. It was just jabbing over and over and over, just trying to poke me basically.
And once that happened, you said you had to walk away?
Yeah, I just I don't know, like some instinct in me was just like, get up, get off, like get out of there.
Survival.
And when that happened, how did you feel?
I was just like dazed, and it's like really like blurry and just like, I don't know. It's just, it's honestly that entire part of the night, like is the least there I am, I would say.
Okay. And at some point in time, what are you doing in the yard after this happens?
I realized that De Silva is in a fight with his own group of people, and I kind of just stood there and watched.
And do you recall whether or not you engaged in that fight at all?
No.
Now, how long would you say that whole fight took place?
A minute. And
when the fight was going on, what kinds of things do you recall seeing about kind of watching the De Silva fight?
What do you mean by that?
Well, I mean, you kind of just stood there, you said, and watched, right? What were you watching? What were you seeing?
Just people throwing punches, I guess. And that's really all I can recall about it.
When you were engaged with the defendant, do you know whether or not there was more than one person engaged with him?
No.
It was just you and him?
Yeah, from what I know.
And at some point in time, when you stop, when you back off from the defendant, do you see where he goes?
No.
Now, when you recall, if you can recall the De Silva fight, do you recall how many people were engaged with De Silva?
3, 4 people.
3, 4. After the fight ends, at some point, do you realize that you're injured?
So kind of as De Silva's getting pushed out, my buddy Ty Wood was right next to me again. And he's like, dude, are you okay? And he's seen my clothes and pointed it out. And I had already started to bleed through my sweatshirt and my shorts. And that's also when I heard my lung collapse in my chest. And I don't know how to describe it, but it was bubbles coming from out of my chest. And I just immediately got super scared, and I didn't know what was going on.
And when you say you were bleeding,
yeah.
So did you say anything how did you realize that you had been injured?
I just kind of lifted up my shirt and looked, and I was like, holy shit, I was stabbed.
And when you realized you were stabbed, at that moment, did you hear anybody scream anything?
No.
Did you see anything else at that point? What was going on?
I kind of just went into I don't even know how to describe it.
It's called
I
shock.
thought I was going to die. I heard the bubbles come from out of my chest, and I just immediately thought the worst. And I walked myself back in through the cellar doors into the basement and sat down and was like, I want water.
Okay.
No more beer.
Now, when you were fighting with the defendant, did you have a weapon on you?
No.
Do you recall if Ty Wood had a weapon on him that night?
No.
Do you recall if Nikki DeJesus had a weapon on him that night?
No, none of my friends carry weapons.
probably wanted water because he was out of breath with only one lung functioning.
So I'll show you State's Exhibit 60.
Just, did you see that demon look? Stared right to our souls. It just looked at the camera. It sounds like they started this fight.
Yes, sir!
Okay, now, this individual right here on the left, the green sweatshirt, do you know who that is?
That's me.
That's you?
Yeah.
Do you recall at this moment in time in the video, first of all, have you seen this video before?
Yes.
And do you recall, based on your recollection of when you were engaging with the defendant, is this video before or after you were already stabbed?
This is after I was stabbed.
So how is it that you're standing there watching Tyler Da Silva, and how is it that you don't know you're stabbed at this point?
I just didn't know. Like, I just had so much adrenaline going through me. I was like, this is the point in time where I, like, just something told me in my head, get up, get away from this, like, and that's where I am now. Like that's where I kind of got up and I kind of just walked and was like, all right. And that's when I realized, like, there was a whole nother fight going on. I didn't even know really there was another fight going on. I really thought it was just me and the defendant.
And at some point in time, actually, you can play the rest of So at some point in time, you recall hearing, he's got a knife, he's got a knife?
Yeah.
Okay. At some point in time, at what point in time do you realize that you're stabbed, and then you indicated you went down, you talked to Ty Wood, and then you go into the basement? At what point, I guess, in that timeline is my question?
Like the same exact time.
So you hear, he's got a knife, he's got a knife.
And Ty Wood's pointing out to me that I got stabbed.
And then you're lifting up your shirt. Now, I'll show you State's Exhibit 61. Can you see that?
Yeah.
This individual here on the left with the phone out.
Yeah.
Do you know who that is?
That's Ricky Fiola.
And at this point in the video, you're already stabbed?
Yes.
So is there a portion of this video that does not capture the beginning of the fight?
Yes, there is.
Is there a portion of this video
Had
that
this
does
video
not
started
capture?
earlier,
What?
we would have seen the entire fight.
Yeah.
That's a terrible
State
question.
63.
I think he will. I think this is a self-defense case. I think he's going to tell his side.
Do you know who this is here?
That's Sal.
Sal Perry?
Yes.
This individual here with no shirt on? You know
Alex.
Alex Ferguson?
Mm-hmm.
How about this kid here with the red hat?
Michael Samperry.
And this is?
Da Silva.
And do you recall being here in this moment in the video?
That's like the only like point of view like I remember of like watching Da Silva. Like this is like what I remembered from that. Yeah.
And it's a few seconds after this that you realize Ty Wood comes over.
That's like when everybody started figuring out they were stabbed. Like I want to say like Faison might have been the first one that realized he was stabbed, and he was like, holy shit, like I was stabbed. And then everybody is just like, whoa, like what's going on? And
when you realized that you were injured, did you notice aside from Faison, did you notice if anybody else was?
No.
you kind of just lifted your shirt up, went right into the basement, and
pretty much
sat down, said, I need a glass of water.
Yeah.
Did anybody else follow you into the basement?
Some people did, but I just don't. I don't remember who it was. Some people did follow me into the basement, and somebody did grab me a glass of water, and then they helped me out back outside because they were like, the ambulances are coming, they're about to be here, you got to come back outside. But I don't remember who it was.
Why don't you remember?
It was there was just so much going through my head at that point in time. Like I truthfully thought like I was gonna die. And it was so hard for me to breathe. I didn't know I had a collapsed lung. I heard those bubbles happen in my chest, and I was just thinking the worst. And I truthfully thought like I was gonna die in that front yard or basement that night.
Did you know what was going on at that moment?
No, not really. I was just kind of in my own world, just like, don't die, just one breath at a time. Kind of like that. That's literally what I got down to. By the time I was brought back into the yard and my lung was so like collapsed and stuff. Like,
could you breathe?
Like barely. I was like that. I barely was able to breathe, and I was just like one breath at a time. Just I literally took it down to seconds. Like I was thinking so small. I was just like, just one step at a time, and I'll make it. I'll be okay, and all that stuff. But yeah, I was just so in my own world, just thinking about life and my life to that point in time. I truthfully thought I was going to die. And
maybe this might be a good point to stop for the day.
All right. Right. So we are going to adjourn for the day in a moment. So before I do that again, I'm going to do my daily reminder to the jury. So again, please, you must abide by the rule of juror conduct that I described to you at the beginning of this trial, and the instructions that I gave you the end of the first day of trial, and the ones that I have repeatedly told you to continue to abide by. Please leave your notebooks behind. Have a good evening, and we'll see you back tomorrow to reconvene with the evidence. Thank you. Court stands adjourned.
There we go. That's how we're going to end it today. I like this witness a little bit better. I don't think his grasp of his role in this is extremely accurate. Like, he doesn't understand why it would be an issue for him to have, started the fight, pulled the shirt over his head. That's an assault, right? And then got stabbed. I want to hear more. I want to hear more. But if we've got multiple people attacking the defendant in a fight, he's being goofy with his shirt over his head, saying, I'm looking for this guy, looking for this guy. I don't know what else is going on yet. Everyone's just sort of said we were getting chippy with them. Connecticut has a rule. You've got to back down. You've got to try to retreat if you can, unless your life's in danger. I don't know, stabbing 4 people in self-defense seems a lot. But it seems like it's one of those things where if he had stopped right where he started, he might be okay on the self-defense front. But this, 4 people is a lot. Anyway, all right. That's where we are today. Tomorrow, Hump Day. I'll be here early for the Hump Day yell. Also tomorrow, 8 p.m., I'm going to be on Courtroom Confidential talking about this case with Josh Ritter. Please join us. It's always a blast to hang out with them. They are absolutely amazing. I love talking to them before and after. I'm sorry you guys don't get to see that part, but they are so much fun to hang out with and just shoot the breeze. But we'll be back tomorrow to talk about this and probably a couple other cases and things that are happening. Let's see if we've got a call here. Oh, it's AWOL. Hang on a second. AWOL, hold on a second. Hold on, AWOL. Okay, I have to repair every time. This is, forget that device. All right. AWOL, can you hear me?
I can hear you.
I've only got you in my left ear for some reason, but that'll work for now.
Sounds good with me. I can hear you.
Awesome. What's on your mind? This is a tough case for me, but go on.
It is a tough case, but I could understand. There were a lot of cases that we all watch, and some people have or lean toward the guilty or not guilty. But if you're not from a certain state, or if you don't live a certain lifestyle, you can see a defendant as being guilty, or you can see whoever going, why would you do that? My thing is, if you're not from that culture, you might not understand it. So as a trial watcher, it is easy to go, oh, he went and got a knife.
Yeah.
But I have been involved, allegedly, in so many altercations
allegedly
that it could have went haywire. Luckily, it didn't. Some of them went bad, and it made the newspaper. I wasn't there that day. But we have to understand that some cultures are different. Some fights are different. Men are different. Boys are different than girls. Girls fight too. So let's not just make this about a male thing.
Yeah. I saw more girls fight in high school than guys for some reason.
Really?
Yeah. My school was vicious.
Really?
It was crazy.
I didn't see that. I mean, I don't know where you went to school at. Sign me up. We're gonna do draft
It's not a good thing.
No, it's not a good thing.
Yeah.
No, listen. I also want to say that violence is no answer for anything.
Right.
There is no need for violence. Right.
No.
Everything should be able to be talked about. But all is fair in love and war.
I was not a fighter in school. I was a runner.
Yeah, but you're tall.
Get in a fight and run away, live to run another day.
Tall.
So
yeah, that's because you're big.
I don't know, but I will say this. I had a weapon almost every day of my life. And it wasn't a weapon, it was a tool. It's like we always had pocket knives. I mean, I graduated high school in 95, right? So this is a different era, right? After 2000, everything sort of changed a little bit with Columbine and all that. But I always had a knife. And sometimes a BB gun. I mean, my car just had stuff in it. My backpack had stuff in it. I was going fishing 5 days a week, and I'd take the same backpack that my books were in. Up, throw the tackle in there and head up the canyon. Yeah.
Right. So I will keep it Pickles, but it was a different era. So it is what it is. Yeah. As far as this case is concerned, I'm sorry. I come from a place that fights happened every day. I don't know if people in chat came from different neighborhoods, and that's okay. Everybody has a different life.
Yeah.
Some have silver spoons, some have no spoons.
Yeah, and
some
arguably, this group seemed to have a lot of
bootstraps.
silver spoons. I mean, this is the lacrosse and the football.
No,
teams.
I don't think so. I'm sorry. I'm sorry to cut you off. Say it again.
They call it, other places are calling this the preppy murder. This was a fairly well-to-do area. These are kids that were doing okay, came from good backgrounds.
Correct, but that's almost, as I almost want to agree with that concept, but that's almost a cop-out, because if you come from a poor background and you do something that you are guilty of, I don't think it's fair to say, oh, because they're preppy, I'm allowed to do that.
Yeah,
and
it's not an
you know
excuse.
what? Back to Pickles.
Yeah.
Back to Pickles. So,
let me say this.
Regardless of the situation, you cannot invite somebody to a fight, and when they get there, you now jump them. I have seen plenty of fights. There were fair ones, which in my vernacular is considered a one-on-one. Even though there was 30 on 30, but whoever had a problem is considered a fair one. You fight versus that person, and once it gets a little crazy, where you're about to murder him, we stop it. We don't get into like a WWE brawl. We stop it and go, you won, we lost, we won, you lost. And that's it. And we could meet up next weekend and we'll do it again. Right. So there was no murder. There were no weapons. It was like a honor type of thing. But again, this is 2000. Yeah. I don't think the youth with Snapchat and the likes and the hearts and the Instagram, I think that honor has gotten lost, and the honor has been replaced by how many likes can I get? How many views can I get? So there's no de-escalation. I don't know how we change that. This is probably a crazy thought experiment that I added to the chat community that they didn't want, but it is what it is. This is what I do. Thought experiment.
Yeah, that's awesome. Yeah,
I love this.
I feel terrible about this. This is an outcome that was so avoidable at so many different places. The ability to handle confrontations properly is something we need to teach our kids, because the idea that we have to go nuclear at every crossroads is it's wrong. It doesn't work. It doesn't work as adults, and it doesn't work as kids. It just leads to trouble, and it takes away opportunities, takes away futures, and it takes away lives, unfortunately. But there you go. That's my lecture. That's all I got.
I agree with you. I agree with you because I used to say, look at this old man with his house and complaining about us riding our bicycles. But now I'm the guy that's saying, get off my lawn. Right? So I don't want to pass judgment on the youth because I didn't grow up with cell phones. I didn't even have a pager in my day. So I don't know what the youth are doing and what their lifestyle is like and what their culture is like. So I don't want to be a get off my lawn guy. But at the same time, I think it takes adults, church communities, boys and girls clubs, to mentors to go, hey.
It takes a village,
teachers
right?
To say, yeah, it takes a village to go, listen, you don't need to do that. Nobody cares about your life. Your TikTok views are not going to make you a man or a woman. You're going to regret all of this in the future because it's going to be cemented in history on the internet. And if you want to run for office, they're going to bring it up.
Yeah, that's terrible.
I don't know what the case is, how to do it, but anyway, that's just my point of view on things.
Great
as far
to
as
get
this case, I don't know.
Appreciate it. I'm going to think this one over. I'm looking at this. I'm trying to look at this with all the testimony that's come in and saying, can this guy get can the jury look at this and say this was self-defense? And I think maybe it's possible in individual instances, but when you put all four together and he stabbed 4 people in self-defense, I'm like, wow, that just seems like everyone he get his hands on. I'm like, what was he, John Wick? How did he do all that? He's fast and he's crafty like the devil or something. His eyes, he's got the demon look, right? All right, AWOL, thank you very much. I appreciate it, my friend.
All right, I love you all. Shout out to chat, shout out to mods, and happy birthday, Amber.
Yep, sounds good. We'll see you, man. Bye.
All right, be safe. Peace.
Okay, now I'll turn the mic back to regular level. I had to double it to get the right and left working. All right. I think that's it. I think we're going to... Nope, that's the wrong one. That's the wrong sound bite. We want this one. There we go. That's the one. We got caught up today. I realized we put in a lot of hours, a very little break. But thank you all. Thank you all. We were caught up. We're going to let this one play out. I've told you it's going to be a little repetitive with each witness that gets up and tells their version of who's who and who is standing where and who said what. But through all of it, I think although each individual one might be remembering things wrong, we're getting a complete picture altogether. And eventually we're going to be able to name everybody off in the video and recognize voices and who yells what. And maybe at the end of this, we'll see what actually happened. Maybe the jury can see this clearly enough to reach a conclusion. So tonight when you go home, please hug the people you love. Smile at someone. Make their day just a little bit better. Please stay safe till we go live again tomorrow morning. Hump day. Yell first thing in the morning. So if you don't like the yell, be late. If you do, be early. And stay cool. Oh my goodness, stay cool. I'm going to go upstairs and see if it's less than 90 degrees upstairs. That's my goal. Less than 90 is what I'm shooting for. And then I have to work in the bathroom. We're so close to painting. It's not funny. You guys have a good one. We'll see you tomorrow.